Colleagues, good morning. May we be seated so that we can start with our meeting?
One, two, one, two, one, two.
Colleagues, good morning once more. I think we are sorted now, if I'm right. I want us to start our meeting. Well, I want to believe that everyone else has the agenda. If we do not have an agenda, all of us, I'm not very sure, Albertina, whether you want to Well, colleagues, let me open this meeting officially this morning and welcome everyone, starting with the members of the Portfolio Committee. Minister, thank you very much for coming. We appreciate every time when you are here because we get to ask the questions directly to yourself and we get the responses from yourself. So it helps, and we want to say thank you very much, and also appreciate the fact that every Tuesday we do get the update on the foot and mouth disease as we've requested as a committee. So we really, really appreciate it. We've been on oversight. We did get your apology as we're going to the oversight in the Free State Province. We went well there. You will receive the recommendations once we finalize the findings and submitted to Parliament. We were joined by your officials, and we want to say thank you. The DG did also join us virtually in our meetings where we needed a clarity from the issues, especially on the foot and mouth disease. Minister, thank you very much. I have been given an apology for the Deputy Minister. I don't know whether she's here. Okay, so I got the apology. I thought probably she'd be here. But I would like to allow. Okay. So I'm told that all members of the Portfolio Committee are here, except for Honorable Madlala, who's not here, but he was with us at the oversight, so he has apologized for today. I want to take it that it still helps us because we do form a quorum. The next thing I want to welcome the entities, the leadership of the entities of the Agricultural Research Council, the chairperson and the team, the National Agricultural Marketing Council, and by the way, I'm told, Minister, we have a new council. I haven't heard from yourself. So probably we'll meet the leadership of the National Agricultural Marketing Council and the PPECB, the Perishable Products Export Control Board. I hope that we have the chair and the CEO and the CFO, or the chair, the chairs, the CEOs, and the CFOs of all the entities. I can see the faces of the CFOs because I'm very interested in seeing them. Beyond them, I see that we have all the CEOs and and the chairpersons. Thank you very much for availing yourself for this morning meeting. The agenda stands as follows. We will start with the minister and the department on the update on the foot and mouth disease, as it's very important as standard since we had requested. And just before the members go on constituency work and some resting time, we do need to know as to what is happening in all the provinces. You know, when we were in the Free State, I think we went to the Free State with 300 and something infections. By the time we were there, the MEC actually told us they were standing at 404, which makes them the real epicenter. However, there's a lot of work that is happening there, Minister and DG, but we still want to see more happening. The challenge having been that, or that the farmers decry is that they lack farmer support, and I think that we have to speak to that, to those issues of farmer support, Minister, and the DG. I also want to hear what the ARC is also doing on that score, because they are also part of the of the team that is supposed to assist the farmers on foot and mouth disease. We have learned, Minister, that there are other opportunistic diseases like brucellosis and the others that are challenging, that are giving the farmers challenges there, that are complicating the situation. However, I think that you will be able to brief us when you brief us now, and so that we know how far are we doing. The other challenge that farmers there raised was the issue of whether they are going to get the second round of vaccines or vaccinations as a boost. They seemed to not be very sure, but they were assured by the MEC and the team when we were there. So these are the issues that we're just raising. For example, I'm making an example with the Free State because we were there, and my take is that it may be that in the other provinces they also have that uncertainty, and that would mean that the department will have to up the standard and the scale of communications in this situation. Let me hand over to you, Minister, to then lead us on the update on the foot and mouth disease. Thank you.
Good morning, Chairperson and members of the committee. Thank you for the opportunity to be here. I'm joined by the DG, DDG Sarache, Dr. Morisani, and other officials who will take us through the presentation. Let me just make it very clear so that there is no misunderstanding. It is our intention to have vaccinated 80% of the national herd by the month of December. I believe we're on track to do that. And as we committed, we are procuring vaccines now in large batches, and there will be more than enough vaccine to not only do the initial doses, but to do the secondary doses. Every MEC is well aware of this. There is a fortnightly MINMEC that is held specifically on FMD updates, where every single MEC and every single head of department provincially is briefed with the latest updates. The quantities shared with them, and this is important because the provinces are responsible for the rollout in terms of the identified priority areas with the prioritized vaccination program. So I don't want anybody to be under any illusion or misapprehension that there will not be enough vaccines to do the initial shot as well as the booster shot. We are procuring vaccines, as I said now, at scale, and there will be plenty of vaccines, I believe, for us to meet that target by the end of the year. I'm joined by the DG and Dr. Morisani, and I don't know if the DG wants to add anything particularly there before introducing the team. Thanks.
Thank you very much, Honorable Chair, honorable members of the Portfolio Committee on Agriculture, and please accept our apologies for not being all the time with the team of the department when the Portfolio Committee was in the Free State because of other commitments. I think, Chair, in terms of what Chair has already raised, let us also indicate that some of those that the Chair has indicated, Dr. Mudisani would be able to indicate that they would not be opportunistic. These are state-controlled diseases like your brucellosis, and therefore they need to be controlled. Currently, there are registered vaccines relating to all those that are there, but we will get the details in terms of the report so that we can be able to properly respond to the issues that have been raised by the farmers. If it's an issue around the availability of the vaccines from their side or even affordability of the vaccines, I think it needs to be addressed at that particular level. We are bringing the report that is an update from what we gave from last week, and Dr. Mudisani, with your permission, Honorable Chair, will take us through the presentation. And we are here for any other questions that the Portfolio Committee or guidance that the Portfolio Committee would give. Thank you.
Thank you very much, DG. I just want to say that just before you start making a presentation, Dr. Mudisani, that we did not let you down. You were worried when we said we were going to the Free State, and we did our best to do our job, to do oversight and nothing else. You can be assured of that. Thank you. You can make the presentation.
Thank you, Chairperson. Thank you and good morning to honorable members of the Portfolio Committee on Agriculture, Minister, DG, and CEOs of the state-owned entities and the chairpersons of the board. This is an update on the foot and mouth disease, and that is the outline of our presentation. Normally when we do this presentation, we also give the current situation to try and depict what is going on in terms of detection. We can see that in KwaZulu-Natal, we picked up a new infection in the valley, Carlton Valley, where we reacted by immediately sending 15,000 doses of vaccine to assist in the arresting of the spread of the disease. And in Lihuru Tsidinokana, we, in the northwest, we also sent out 10,000 doses of vaccine. There were reports in Limpopo, Waterberg, Makado, and Mole, and we sent out 10,000 doses of vaccine. That is in addition to what we had already allocated to all the provinces. Northern Cape picked up an outbreak in Datlas, and we didn't send out any vaccines because they had not yet collected their vaccine from OBP because they still had an allocation that they had in the province. We encourage provinces not to take vaccines into their stores so that they keep them, and then we don't have vaccine available to attend to emergencies. In the next slide, we have a map. We updated this map yesterday just to depict where the new outbreaks are. We can see that in the Western Cape, we still have basically, I want to say, 2 foci, wherein we have an outbreak or outbreaks, and then in the Northern Cape, we can see that single red dot. We still have quite a lot of red dots in the Free State, in KwaZulu-Natal, and then they are also increasing slightly in the Eastern Cape. In the next slide, we have an update on how we have been reporting. Incrementally, we can see that on the 2nd of March, we had 932 outbreaks reported, 10th of March, 957. We are now at 1152. The numbers are still increasing, but we should not necessarily associate this increase with necessarily the number of increases. It's the detections that we are making in terms of the reports that we are receiving from the provinces. Next slide. The department has established a command center. There is a toll-free number there, and then there is a website in which the reporting is also happening. And we do have colleagues that we have appointed, and their emails are provided there. The command center is very active because it is receiving quite a significant number of queries from the general public. Next slide. That is a very busy slide, Chairperson, trying to indicate how much of the vaccines that we have received, how much have we allocated to each province. We have also tried to categorize the companies that supplied us with vaccines to see how much of each of the vaccines have we allocated to each province. As we indicated in the previous presentation, we had kept around 75,000 doses for emergency purposes. And in the first slide where we updated how we have allocated the doses for emergencies, we have already used around 45,000 doses. And on the extreme right, we are indicating the number of animals we have already vaccinated now. And just for the noting of the meeting, we have decided to exclude all other vaccines that were done or vaccinations that were done previous to the allocation, since we got the 12,900 from the ARC, so that we do not confuse the situation. So we have done over 1 million animals at this moment with the 2.5 million doses we have received. Next slide. And in that slide, trying to give the committee a balance of the vaccines that we still have at hand, meaning that the vaccinations will be continuing. Next slide. Minister has alluded to this. We have placed orders for additional vaccines, 2 million additional doses from Dolvet. An order will be placed. We just got the SAPRA permit yesterday. And then we also placed an order already for 1.5 million doses of Biogenesis Bago vaccine. The first ones, the Biogenesis Bago may arrive anytime from tomorrow on. Next slide. This is a brief update to the portfolio committee in terms of what is happening. And then DG has indicated that we should also respond to the concern. Minister has already responded to the fact that there is intention to do booster vaccinations throughout the country. The advantage of the two vaccines that we are using right now is that the second dose may be given 6 months after the first dose. So in 6 months' time, we expect that we will be able to go back and do the revaccinations. And every time where there are challenges in terms of possibilities of reinfections, there will also be the responsibility to go back and revaccinate the heads that have been vaccinated. We request the portfolio committee to take note of the updated report on foot and mouth actions. Thank you.
Thank you very much, Dr. Motisani. DG, is there anything you want to say, or DDG Sarache, where are you? You fine? Okay. Thank you very much. Honorable members, it's your opportunity now. Honorable Smith, Honorable Aris. Okay, let me note you properly. Honorable Smith, Honorable Aris, Honorable Ndalane, Honorable Nkosi, Mthethwa, ukhona Nyambozi. All right. Nxutham, siphakeme isandla. Okay. Have I left somebody? Honorable Trolley. Oh. Dr. Nkabane. I want to believe I've noted everyone else. Let's start, Honourable Smith.
Thank you very much, Chair. I've noticed that the Minister were moving through the various provinces. So if the Minister can maybe just give us some feedback in terms of the performance of various provinces in terms of rolling out the vaccination, making sure that traceability and all of that is in place. The second matter I've noticed is the phased rollout of departure of vaccines from Turkey in terms of the conflict in the Middle East. So maybe just to clarify that specific matter. And then there was now another thing that I forgot. If I remember later, I'll
You can come back when you remember it. Honourable Aris?
Yes, thank you very much, Chairperson. Chair, my question is just the 2.45 million doses that was available, only 1.18 million was used. And we want to find out what is the main constraints for the slow vaccine rollout. And then, Chair, in the rural areas, we want to check that are there sufficient cold chain management, to store the vaccines. And then also on slide 4, Chair, in the 18 days, when you look at the presentation, in the 18 days, from 932 to 1,152, it's an upward trend. And they must tell us what is the drivers for this upward trend, that the infections increase. And then, Chair, we also need to get a report on the economic impact, because every week we get these presentations, but we don't get a report on what is the impact on the economy, what's the impact on the farmers. And then, Chair, with the balance of the vaccines of the 1.3, but how long is it going to last, given the current infections? And then, Chair, last week when we were out in the Free State, we did hear the cry of the black farmers that don't have land to quarantine their animals. In the absence of land, we are not going to combat this disease, because the people don't have land to quarantine their animals. And we need a report on what interventions was there between the municipalities, between the provinces, in order to assist these black farmers. So that's why we need a report from the provinces and the local on the availability of land specifically for black emerging farmers. Thank you, to ensure that they can also quarantine their animals. Thank you.
Thank you very much. Honourable Ndalane.
Thanks, Chair, and let me also welcome the update report from the department. And mine, I think other questions has been covered by Honourable Smith. And is that how will the department monitor and report on vaccine, on efficiency and potential side effect? Thank you, Chair.
Thank you very much, Honourable Ndalane. Inkosi Tebekhulu Ndabezitha.
Thank you, Chair. Good morning to all members, the Minister and the team. I think my main point, Chair, was with regards to the land availability for the livestock owners. As we were driving up to Joburg, what I noticed, Chair, was that there's a large keeping of livestock out there. People residing on those settlements, those shanty towns, I would call it, or township.
Just raise a bit your volume and a visitor.
Oh,
Yeah.
maybe mic on my face. Chair,
Yeah, that's
the,
better.
the problem of land availability for livestock grazing. The number of heads as we were driving up along the road, two large heads of cattle around there. My understanding maybe will come from the side of the livestock owners in our rural areas where people keep more than the size of the grazing fields. If maybe the department could maybe engage livestock owners not to overkeep the livestock, so that maybe they could compete on that small areas where they've sort of, I would say, invaded in order to have their livestock. The commitment as well, if the department could then engage other departments with regards to land availability for those people out there in order to avoid the clashes, because seemingly it appeared that there were some clashes in some areas where people would take their livestock for vaccination, and some were sort of resisting taking their livestock for vaccinations. Those are the challenges one would just to try to point out. Thank you.
Okay. Thank you very much, and a visitor. Nyambos.
Thank you, Chair, and greetings to the Minister, the DG, and fellow officials, and members of the Portfolio Committee. Mine is to say, because I saw the word strategy in the document that is being presented, so I feel then that we need to rope in Land Reform Department, because we need a strategy to address the issue of access to grazing land and quarantine facilities, wherein mostly the emerging and communal farmers, they don't have access. I'm raising it so that you don't shoot it down by saying it's not our line function. Now I'm raising it to say, as a matter of strategy, we now need to go to land reform, sit down, identify land pockets, and disintegrate the herd, the national herd, according to equitably, if not equally. Because the reason I'm raising this, when we visited Parys and Sasolbeck, they raise an important issue. They say, we vaccinate these cattle, they go and jointly graze with other cattle. In the communal setup, you would normally have one shepherd who collects all the herd of other families or households to shepherd them for grazing throughout the whole day. When they return, he then separates them according to different houses. So you are directly conflicting with the protocols of this outbreak. So which means to address this matter, the land is becoming an issue too. The issue of land audit is also part of strategy, so that you don't say I'm talking about land. As a matter of strategy, we're sitting with land pockets, among others, your Sandra, say state land. There are a lot of pockets that sit with different stakeholders that are part of the state. But that land is hoarded. In fact, I'm told where we come from in Paris, they said Sandral has land, but that land has also been ring-fenced by few commercial farmers, not for purpose of redistribution, to hoard the land for their own reason, especially in Paris. So which means we do have land, but we are not engaging the relevant people. In terms of pigs, the pig farmers are saying the protocols are different, the manner in which we address your livestock, cattle versus pigs. We need to come up with measures so that how do you address the issue of pigs? The turnaround, the keeping of pigs is such that they are procreating almost in mass. And then you now, based on the protocols of this disease, you need to quarantine them. keep them. And they are increasing in number and they are not exiting. So there's no exit strategy. We need to come up with a way. How do we deal with that? The confidence on the vaccine is an issue amongst the black communities. They are saying, we vaccinate, then the reasons were given by the veterinary doctors that side effect diseases are affecting the herd once it is already contracted the foot and mouth disease. But to people, that is not normal. It means this vaccine is the cause of the death of their cattle. So which means we need education here. Can we engage agricultural practitioners, even those who are non-veterinary practitioners or doctors? We have 5,000 of them that are sitting. They understand the language just to demystify the mystery of death even after vaccination, that it is not a direct effect of the vaccine, but it is actually a side effect because the immune system get affected. And those things are not easily explainable to the people. Then the rest, I think I will leave it to other colleagues. Thank you.
Nyambose, Honorable Mwetama.
Thank you, Chair, Honorable Minister, members of the department. I have just two quick questions. Now, can we get a sense of how the vaccine is distributed between the small-scale farmers and the large-scale farmers? And we know in South Africa, when you say large-scale, generally you mean the white agriculture, and small-scale is black farmers. So if we can get a sense of the distribution. And also to get a sense of whether we are able to deal with this matter effectively, because we know in South Africa about 12 to 15 million head of cattle in total, but we hear the number of vaccines which is mentioned is about 1 million or 2 million. So let's get the sense of how are we covering the total head to deal with these recurring flare-ups. And then my perennial question is the penalties for transgressions. The old legislation does not provide for effective punishment for transgressions. Is there any thinking in terms of policy to strengthen the punitive measures so that transgressors can be discouraged from transgressing on these policies? Then, Chair, my final issue relates to my perennial complaint about the 16 million rand, which has been shifted from small-scale farmers in Gauteng. In the last meeting, we raised the matter, and we were assured in the meeting that such shifting of money is not permissible by policy. But in the following week, the presentation showed that indeed 16 million rand was shifted from the CASP program to FMD in Gauteng. And I am in touch with those small-scale farmers. They're bitterly complaining that they don't get any support. In fact, they are facing eviction, some of them, because they are unable to produce on the farms that they have access to. Chair, one of the biggest criticism against land redistribution is the fact that when we black people get land, we're unable to produce. And that is used to hit the land reform program, to criticize it. But it is clear if this 16 million rand has indeed been moved, that the state itself is busy with undermining and sabotaging black farmers. I would like to get a proper update into this matter of the 16 million rand which has been moved from black small-scale farmers who are suffering in Gauteng. I know that there is issues of levels of government and responsibility and so on, but we had put the matter on the agenda and we had discussed and we did get some commitments from both the minister and the department that the matter would be looked into. I'd really like to get an update so that I can update the anxious, suffering small-scale farmers in Gauteng.
Are you done, Honorable Motama? Thank you very much. Honorable Trolip.
Thanks very much, Chair. Chair, I'm very pleased to hear that there are enough vaccines to handle the outbreak and follow-up, because that's not what we picked up in our oversight visit into the Free State. And we accept that provinces are responsible for priority areas and handling of the outbreak in their provinces. But we discovered that there was a shortage of vaccines, and people that had not yet had their herds infected were distressed that they were not able to access vaccines. So when the Minister says that we will meet our 80% target by the end of the year, that's reassuring. What's less reassuring is the fact that the organizations that were litigating against the department were instructed by the courts to undergo arbitration. We note that that arbitration was not successful and that the litigation will proceed. And the Minister described these organizations that are litigating as mega fringe organizations. But we do note, and I note, and I've sent it to the committee, that Agri East Cape, who is part of Agri SA, is also released.
Honorable Trolip, just wait, Minister. Is
in this committee.
Let's allow him to
In this committee. In this committee, Chair,
yes.
the Minister referred to them as mega organizations, and it's on record, so we can get it.
Minister.
I said mega fringe organizations. I wrote it down here. I said mega fringe organizations.
Yeah.
Now,
sorry, Honorable Trolip. Minister, allow him to speak. If we need to go back and check, we will do so.
now, Chair, Agri East Cape, who is also part of Agri SA, have released a press statement raising concerns that are very similar to the concerns raised by SAI, Sakaliga, and Agri Free State. And they talk about lack of coordination between the ministerial task team, the industry coordinating council, and farmers. And that's something that we picked up in our oversight visit as well. And also they raised the fact that the regulatory framework is designed for an outdated strategy, where we were trying to retain FMD-free status without vaccination, and now we are trying to do the opposite, which is FMD-free status with vaccination. Now that implies that we need to vaccinate as much of the national herd as possible, as soon as possible. And it appears that we're not keeping ahead and that we are still chasing this disease. Now, when I look at the allocations in the presentation made by Dr. Modisane, one of the allocations to the 9 provinces is a concern, is the one from the ARC vaccine, that distribution of 12,900 vaccines. We were informed that the ARC/OBP would be producing 20,000 per week by the end of March. Can we please get an update on how close we are to meeting that target? And then around additional doses coming in, Dr. Modisane's explanation that the biogenesis will be arriving any day now from tomorrow doesn't coincide or reflect what is in that report on page 8. So I would like Dr. Modisane to speak specifically to the graph on page 8 about the status of the various vaccines coming into the country. And then, Chair, around booster vaccination, all the farmers that presented to us last week in the Free State were very concerned that it took so long to access vaccines for infected herds, and those that were trying to access vaccines for uninfected herds were not successful. And now their greatest concern is that will they be able to follow up? And if you just look at the numbers of how many vaccines have been distributed, how many have been used, and how many are left, and the challenges of daily increases of infections, we're not going to be able to meet those requirements under the current dispensation. And this too was also raised by the Agri-EC press statement. Agri-EC, in their press statement, statistics around infections and new infections is way different to that on the presentation. And Dr. Morisani would have to clarify that for us too, please, because it seems underdeclared. And the last comment I want to make is that everyone we spoke to last week admitted that there is an underdeclaration of infections and outbreaks because people fear the consequences of being quarantined or restricted to zero income. So underdeclaration is a major issue, especially if you look at that Agri-EC press statement and compare the numbers that they're talking to and the numbers that we've got from the department. Thanks very much, Chair.
Thank you very much, Honorable Trollis. Yes, Honorable Aris?
Can I just have a last question before they respond? That something that have slipped my mind.
Yeah, just write it down. I still have Dr. Nkabani to,
Okay,
yeah,
thank
to come
you.
in. You'll
Thank
come,
you,
you'll
Chair.
come back after her. And Honorable Smith, if you have remembered your question, you can come back later.
It was covered now.
It was covered now. Okay. No, that's fine. Dr. Nkabani?
Thank you so much, a Chairperson, and greetings to the Minister with his team present here today. I'm going to join honorable members who have just welcomed the presentation, Chair. It's very good to get a sense on their distribution strategy. Hence, the report also incorporate what we have in stock currently, how much have we used in terms of the vaccine rollout plan, and the balance that we have. So looking at this, Chair, I just want to get a sense from the team, taking from what Honorable Trollip has raised around the booster shot. Hence, we are requested, or as per the protocols, we need to, in 6 months period, to have a booster vaccine to our livestock that is affected by the FMD. Looking at our capacity currently and what we are capable of procuring, are we going to be in a position to comply with the 6 months period in providing a booster shot? It was one of the concerns during our oversight that was raised. Two, Chair, is I'm trying to get a sense, making a reference to the study that was done by the National Library of Medicine, together with what the society is currently raising, because there is a growing call for public-private partnership to combat foot and mouth disease. And the belief is that it is also going to accelerate procurement, distribution, as well as management. When you look at the study that was conducted by the National Library of Medicine, the benefits of that they've actually raised of outsourcing vaccine supply chain functions to the private sector is that it becomes more effective and it reaches those farmers that have to receive it, and there is effective and efficient management and distribution. And the study was done in the province of the Western Cape, which I'm thinking if we can't also maybe deploy some of the lesson learned from that study. Especially because there are many concerns and issues that we can make reference to. Taking from Honorable Aris, he raised economic impact. I'm also going to add social impact. So socio-economic impact, I mean social, to make social economic impact. uh, based on the distress and devastation that our farmers are facing currently as the country. If then we are in a process of already collaborating and partnering with the private sector, what are the programmatic steps and processes that we are embarking on currently to bring on board the private sector in this regard? Thank you.
Thank you very much, Dr. Kabani. Honorable Aris?
Yes, thank you very much, Chairperson. Thanks that you allow me this question. Chairperson, in the previous portfolio committees, we have raised these issues many times, and last week we did hear the cry of the farmers because people are losing their livestock, and many of these livestock are their livelihood. And since the minister is here, we want to know from him what compensation will these farmers get, because many of them have lost everything and that was their only source of income. And if there are, how much funding are available for compensation for these farmers? Thank you.
Thank you very much. Dr. Matheson, I want to request that you go that side so that you can, when you respond, the honorable members can see you, because now you're sitting on the side with them facing that way. It was fine because the presentation point is where you're sitting, but I would like you to move to the other side so that they can see you in the face as you respond. While you are still doing that, I just want to check one or two things. You know, as I said in the beginning when we started the meeting, is that when you came in and made the presentation the last time, was that KZN was sitting at 2.2 and the Free State was at 2.77, if I'm not mistaken. Oh, okay. So, I'm sorry about that. So I was saying that when we started the meeting, I indicated that there is a bit of a challenge in that when last you were here and made a presentation, the KZN was sitting at 202 on infections, and the Free State was at 277. And later on, it went up to above 300. But I said, we were told, and it's in the statement of the Free State Department of Agriculture, that the infections have gone beyond 400. And I see here when you present Dogotela, it still says 316. So the delay in terms of the laboratory confirmations is a problem, because we sit here with the understated numbers of these infections. And we do not have the real time or the closest to the real time. And I think it's because of your laboratories. Now, I want to ask this question that I asked previously as to why are you not working with other institutions that have laboratories? Doesn't CSIR have? Why is it difficult to work with these other entities, if it is difficult? Just to get to understand that. Because I think for us, for you, Minister, and the department, and for the country to fight this disease as quick as we can, and I appreciate that your target is 80%, this year. But we have to work together with other departments that are involved, that can be involved. For an example, the CSR is one of those, and I still get the response. But we also need to work with municipalities. I want to hear how much have you engaged the municipalities, especially in relation to the fact that those farmers who are in commonages and in communal areas, they have raised and stated the fact that it's very difficult for them to separate their head. Like the other members have said, they say it, and one farmer stood up and said, I want to believe that that is why the foot and mouth disease continues, or the disease continues to spread, because we have no land at all to separate the livestock. So when they go for grazing, they mix. And we have picked up that that can also be addressed by the municipalities. So I want to hear, in relation to meetings, you know, the min-max that you have, Minister, with the provinces or provincial MECs and the HODs, how much of the information that you try to get in relation to municipal assistance in this instant, but also how much have you engaged the minister or Minister Hlabisa, who's responsible for municipalities, to be able to find a way of assisting these farmers who are in commonages and in communal areas, because it's very important for us to deal with the separation of these animals so that we can deal with the disease. Yeah, I think those are the two things I wanted to check: the issue around the support from the municipalities, whether you have engaged them or not, and then the why are we not trying to get the CSIR, you know, assisting. And I know you have legally you have a responsibility to make sure that everything goes well, but I think they can work with you under the you know, the guidelines that you use with the ARC, OBP, and the others who are supplying you with the vaccines. I'll hand over back to you, Minister.
Thank you, Chairperson, and thank you to the committee members for the questions raised. I'll obviously deal with some of the broader issues, and then I'll hand to Dr. Modasani and DG, and perhaps the ARC, particularly as it relates to the CSIR question that you've raised, Chairperson. Thank you very much, Honourable Smith. Yes, it's been very instructive to visit the provinces, and what it has done is given us an opportunity to establish some best practice, but also to look at where there are roadblocks to us being able to achieve what we want to achieve by December, which is 80% of the national herd, and that will obviously require at least 28 million doses of vaccine. The batching that Dr. Modasani will speak to is largely as a result of some of the transport constraints as a result of the conflicts in the Middle East. And it has been, certainly from the supplier's side, advised to us that it would be better to break the shipment of 6 million up into shipments of 2 million or 2.5 million each, and a steady flow of those to come in. The reality is that they have been approved by SAPRA. They are on order, and they will be dispatched as soon as possible. The biogenesis bag has also been ordered and will be potentially in the next week. There remain vaccines in the field, as you can see from the presentation, but we imagine that those will probably be consumed by the end of this weekend, and that we would have started to reach the end of the latest vaccine batch. I think that Honourable Aris raises the point about why we're seeing an increase. Well, there's a number of reasons for that. In the past, before we were able to have the mass vaccine rollout, there's been a lack of reporting, and I think the Honourable Trollip has referred to that as well. There's been an under-reporting, and that was largely because people did not want to report for fear of being put under quarantine, and without vaccines available, it could potentially affect their production and the like. Obviously now, with the advent of more vaccines arriving, we're seeing a far greater level of reporting and people coming forward in order to seek the treatment and the vaccines that are required. This is obviously a good thing, and it's certainly part of the communication strategy that the department and the provinces have been rolling out, encouraging people to report cases of FMD so that we can get those farms quarantined and vaccinated as quickly as possible so that they can revert back to normal production. We're confident that with the private sector coming on board, now we'll obviously get back to that when I deal with one of the questions there, that we will be able to meet our target of 80% by the end of the year. We've already begun an extensive process of accrediting private veterinarians and private animal health technicians who have the authority to be able to implement the vaccination process. Obviously, there's a number of issues that have been raised about access to land, and perhaps it might be worthwhile, Chairperson, to invite Minister Nyonso to this meeting so that there can be a full engagement on the access to land. But on the point raised by the Honourable Aris about quarantine, she's absolutely right. It does cause constraints. And one of the good things about having travelled around to the provinces is you can pick up some of the best practice. In the Free State, for instance, the MEC there took me through a detailed presentation that they are going to be rolling out of temporary quarantine stations and working with a NGO called Reheard, and in conjunction with the University of the Free State, they are able to put up temporary quarantine facilities that are then able to be broken down again and moved as and when they are needed. It's also something I've shared with our national department to look at as a potential answer for those particular problems that exist on commonages. Of course, with any Honourable Indolani, with any vaccination process, there needs to be surveillance to pick up side effects. Both Biogenesis Bago and Dolvet have an extensive amount of literature on what side effects to look out for, how to vaccinate properly, and Biogenesis Bago itself has set up a very informative training website for South Africa specifically, which sets out what symptoms to look out for in terms of potential side effects, but that goes along with the monitoring of these particular vaccines. And the surveillance is very important for a reason I'll get back to when I deal with the Honourable Trollop's input this morning. In Nkosi Ebekula, I think you've raised the same issue around communal grazing and the like, and obviously it is something that we're concerned about, and perhaps DG or someone could deal with the issue of overgrazing. But we also do have a fundamental problem, particularly when it comes to local government, and as we've seen with provincial government, where there are areas of responsibility for both those spheres of government. Local municipalities are responsible for operating pounds, for instance, and when we find situations like that, or we do need to impound animals that have been pulled over or without the relevant paperwork correctly with them, that there's very few places we can take them, because although municipalities have the exclusive competence on pounds, very few of those municipalities actually have pounds, and it makes it very difficult to control that problem, but also the associated problem with stray animals going onto the very freeways, for instance, that you referred to. Honourable Nteptwa, I think that I agree with you that we do need to rope in Minister Nyonso's department to come and perhaps have a joint meeting with us to see what can be done in that regard. As it relates to confidence on the vaccine, well, we obviously have to monitor it very carefully in the field, and that is why the surveillance has to remain under very strict supervision so that we can monitor potential side effects and the like. I would be very surprised if any of the vaccines have caused death in any of the animals. FMD itself has a very low mortality rate. It's around 5%, according to the scientific evidence that I've seen. A large part of the deaths come from secondary infections as a result of FMD, but those could also be treated with antibiotics and other remedies. But FMD itself has a very high recovery rate by animals and at a very low mortality rate. The exception, of course, is in dairies, where dairies obviously pick up far more serious symptoms going forward. Honourable Mgitama, the rollout of the vaccine is done on the priority areas and where the infection is the greatest. And it doesn't matter if you're a small-scale farmer or you're a large commercial farmer, if you fall under the priority areas, your animals will be vaccinated. I'm sure we can try and pull the figures around the national herd to date that's been vaccinated, small-scale versus commercial and large-scale. But I would imagine, certainly in places like KwaZulu-Natal, there would be a heavy bias towards the communal herds and small-scale farmers over and above some of the larger operations, because the biosecurity mechanisms are easier to institute in more modern and large-scale facilities, which are absent in many of the small-scale facilities where biosecurity, for a number of the reasons mentioned here today, makes it a lot more difficult to manage on-farm biosecurity. The vaccine distribution, I'm very confident that we will be able to, with our private sector partners, roll out the vaccine distribution and to make sure that we are able to administer by the end of the year the 28 million doses that would be required to have done the initial and then the booster shot. I think that perhaps I'll ask DG and others to deal with the CASP funding. I know that a query has been raised with Gauteng post the meeting, and I'm obviously awaiting the feedback on that, but I'm sure that someone here would be able to assist. I find it odd that Agri Eastern Cape would issue a statement like that when their head of the organization, Mr. Johan Kotze, is a very active member of the ministerial RCC, and in fact visited the Northwest Province with the department as a member of the RCC on Friday last week, dealing with
Minister,
with
I'm
these
sorry
issues.
to disrupt you. What is the ministerial ICC?
It's the implementation team that's made up of the private sector. It's the one I referred to at the last committee meeting. We have a triangle response to FMD. We have the ministerial task team, which deals with the science, and that's made up of veterinarians and animal scientists. And we have the ministerial RCC, which is helping monitor the implementation and rollout of the vaccine process. And they are represented there by the Red Meat Producers Organization, the Red Meat Industry Services, AFASA, the Farming Union, Agri SA, the MPO, the Milk Producers Organization, the Stud Breeders Association, as well as the South African Pork Association and AgBiz. These are people that have been brought on board to help us monitor that particular implementation at a farm level. And it is their responsibility to be cascading the information of what is happening down to, through their organizations, to their members on the ground. And then obviously at the apex of that sits the department. So it's unusual that the statement like that would go out when that organization has a direct line to Mr. Johan Kotze, who is the CEO of Agri SA, and who would be able to answer any of those particular questions. As it relates to the litigation, well, anyone is entitled to litigate, and anyone who feels strongly, I would have thought would have joined that application if that was their desire, and they felt that moved by the application. We are opposing the application for a very simple reason, that it is not possible to allow whoever wants to have a FMD vaccine, a vaccine. And I think members of the committee need to understand that unlike other remedies that often get referred to and thrown about, we've heard about lumpy skin, we've heard about all of these, and farmers can vaccinate with those. These vaccines that have been imported, the Dolvet and the Biogenesis Bago and the BVI, are not registered medicines for South Africa. They're not registered in terms of Act 36. Now, Act 36 is the piece of legislation that assesses any farm feed, fertilizer, or farm remedy and approves it for distribution and use in the country. It is a very vigorous process. It's a very time-consuming process often, because obviously you carefully need to make sure that any medicine or remedy that you're bringing into South Africa, A, does what it says it's going to do, but B, does not have any side effects. The vaccines that have been imported through a Section 21 SAPRA process. And that is a process that provides us to be able, in emergency circumstances, to import vaccines into the country or remedies into the country, given the fact that we have a crisis and we obviously don't have the year or two to go through a potential Act 36 process to register it as a registered medicine in South Africa. So the vaccines that are being rolled out are not registered medicines in South Africa. And Chairperson, I'm sure you'd be familiar with this because it's the same process that was used for the COVID-19 vaccine acquisition when we had to get AstraZeneca and a variety of other vaccines into the country as quickly as possible. We couldn't sit with a long medical process to assess those, and we had to bring them in an emergency, and a similar process was shown. And that is why it is very difficult for the department to just simply concede that anyone who wants a vaccine should be able to have a vaccine and to be able to administer it. And why we've said very clearly that veterinarians, authorized animal health technicians, and private sector veterinarians need to supervise the administration of these vaccines because they are not registered for use in South Africa and they are imported to deal with the emergency procurement. I'm very pleased the way that the ICC and the MTT are operating. Obviously, the MTT tests the science and tests the epidemiology and offers advice on that. And thanks to the ICC, again, with Agri Eastern Cape's main boss, Johan Kotze, sitting on it, have been very helpful in being able to visit some of the trouble spots where we are struggling and to be able to help with communication onto the ground with farmers. It is our intention to vaccinate every head of cattle in the country. And that is why there may be some farmers that are still waiting for vaccines because as we've presented repeatedly to this committee, and as I've repeatedly shared in press statements, when you have an emergency situation, you focus on your priority areas first, and you work out from that. So those areas where the disease is at the epicenter, and you work your way out from that. And that is why areas like the Free State and like KwaZulu-Natal, you have noticed from the vaccination numbers that have been given, there's been a heavy bias towards those particular epicenter areas. And then within those provinces, there's a bias towards those areas where the outbreak is at its worst, and in areas, for instance, like dairy, where the impact and effects of FMD are felt far worse than anywhere else. And of course, you also want to, at the same time, ensure that you're protecting food security and the supply to the nation. And so, yes, there will be some farmers that are still waiting for vaccines. They're probably in areas 2 and 3 in terms of the phased prioritized vaccination process. But by December, every single one of those animals will be vaccinated so that we can hit the 80% mark that we have set for ourselves as the target. And to do so, we are importing vaccines. I'm sure the ARC will be able to respond to the Honourable Trollop's assertions about their capabilities or otherwise. And Dr. Lita is here, and I'm sure he can be able to assist that. There's no concern for any farmer that they're not going to get the booster shot. We are well on track with the procurement. Yes, there was a delay in the procurement, and let me again explain it for those on the committee who perhaps have forgotten it. We had started vaccinations last year. We had vaccinated successfully, rolled out 2 million vaccines across the country, both with the private sector and the state. And we had vaccines on order. In November, the Botswana Vaccine Institute, which has been the sole supplier of vaccine to South Africa for the last 20 years, indicated to us that they had a mandatory factory shutdown, that they would not be able to fulfill the orders that we had placed. We have those orders still on back order, which BVI has not been able to fulfill to date. That meant we had to look elsewhere for vaccines. We did that by immediately approaching other countries to see which vaccines would work here. And of course, those vaccines had to go through a proving process. There's no point bringing in a vaccine and spending the huge amounts of money we're going to spend on vaccines if we weren't sure that they were going to have the efficacy required to beat foot and mouth disease. And obviously, that took a little bit of time. But once those have now been approved, we've started to see the steady increase in numbers coming. And both Biogenesis Bago and Dolvet are able to start supplying us at the rate of 6 million and 5 million batches at a time. And those will be available in that scale and those numbers from now on in, as we have tested those vaccines against what is required. And we have started to obviously streamline the SAPRA process as well. And so I'm very confident that we will, having now ensured that we get vaccines from more than one supplier, will have more than enough supply to be able to reach the target of the 28 million that would be required to have done a vaccination and then a booster shot. And it is something we've committed to doing as part of our strategy. And again, that strategy has been shared with the committee on numerous occasions, with the priority being that we get on top of the current outbreak by vaccinating at scale, involving the private sector, and bringing as many people on board as possible to assist, and that we would be able to meet those particular targets. Honorable Nkabani, thank you very much. Let me just say this, the private sector have never been more involved in the state rollout of a process, certainly in the Agriculture Department and certainly across government. Right from the period last year when we brought together for the very first time the private sector and the public sector to discuss how we were going to deal with FMD, it was private academics, all of the major farming unions, agricultural unions. It was private veterinarians and their representative councils that came together to discuss the strategy, to form an MTT, and ultimately to put before government that MTT again made up 50% private sector, 50% state, to make the recommendations on the vaccination strategy going forward. As I've already indicated, the private sector is very involved in the rollout as well. The ICC is made up exclusively of representatives of the private sector and the industry bodies, so that they are at the very epicenter of understanding what is being done and how they can communicate it to the members, but most importantly also how they can help with the rollout. And in that instance, both the RMIS and the MPO have been very helpful, to the point where the MPO have even now started to supply us vehicles to move the vaccine around provinces and to maintain the cold storage, particularly in those areas like rural KwaZulu-Natal. They've provided vehicles. The RMIS is assisting with ear tags to help us make sure that we are monitoring and properly recording when vaccinations are done. And it is precisely in that public-private partnership that I'm confident we're going to win this battle against foot and mouth disease. So contrary to the assertions of some of the organizations that were previously mentioned, the private sector is absolutely involved hand in hand with government. Private veterinarians on a daily basis are vaccinating animals. Animal health technicians in the private sector on a daily basis rolling out vaccines to animals. And the private sector is absolutely involved in vaccine procurement as well. The Turkish vaccine that is imported is not imported by government. It's imported by a private company called Junevax, headed by Dr. David Gerber. They are the local agents for Dolvet. They import the vaccine. We purchase the vaccine from them. It's delivered and then distributed. There are very effective ways of monitoring the distribution of the vaccine, both through the very efficient and effective chain used by the OBP. And Doctor is here, and I'm sure he will be able to share with you that it is a private company that rolls the vaccines out to the various provinces from OBP. I think it's also worth saying that that has been incredibly efficient and effective in terms of the rollout. Within 2 to 3 days of the batches arriving, being counted, being tested, any breakages determined, those vaccines are out in the field. And I'm sure that the MEC would have shared with you that they are able to do that. Obviously, provinces closer to the OBP are able to draw them down themselves. We've seen the Western Cape as well. The monitoring of the vaccine as well is also made a lot easier, that both the Dolvet vaccine and the Biogenesis Bago vaccine have a QR code on every bottle that allows you to geolocate exactly where that bottle has been implemented or applied. And both Biogenesis Bago and Junevax have both made very heavy commitments to the department and are rolling those out, of assisting us with monitoring the rollout and surveillance that's going to be required of us to be able to do that. Chairperson, I've taken your point about interacting with Honourable Shlabisa, but we have noticed since the declaration of the state of disaster, or the classification as the state of disaster, there has been a heightened uptick in assistance from the municipalities. For instance, when we visited KwaZulu-Natal for our oversight and to go and do vaccination, the local district and local municipality there had put up signage. They were running stop and wash stations to wash down vehicles that were entering FMD protected areas, and were assisting greatly with the policing of the regulations. Obviously, there are other municipalities where there may be capacity constraints, but we certainly are seeing an uptick in the coming on board of municipalities as they've started to realize that this disease can impact on the income and revenue streams of not only their citizens, but also the municipalities themselves. And obviously, we hope that as this process unfolds, we will get more assistance from those particular individuals. As it relates to the economic costs, we obviously will have to work with BFAP and AGBIZ and the other statistical gatherers who regularly are able to provide this type of information, which we would be able to obviously share with the committee once those figures emerge. But I think we have seen in the last set of figures that came out an easing in the price of meat products, and that is largely, I believe, as a result that as a result of the intervention, the strategy, we are able to see more animals going through feedlots and the like, and that is obviously having an impact on supply. Otherwise, we would have seen the price of meat rising and not retreating as it has in this last quarter. Chairperson, I'll hand back to Dr. Modisani to deal with all of the tough technical stuff, and then back to the DG for any input he wants to add, and then we'll hand back to you. Thank you.
Thank you very much, Minister. You know, Dr. Modisani, before you come in, you gave me, you worried me, Minister, when you spoke about the ICC. I realized that you now have the task team and you also have the ICC. The question I have, what are the officials doing now in the department?
Thanks, officials.
There is an entity that's now implementing. Are we not paying officials to do nothing?
Officials sit at the apex of that particular triangle. The centralized triangle system, the MTT and the ICC feed into the departmental response at the top. So the department remains in complete control of the process. MTT is providing scientific advice, and remember, 50% of the MTT is made up of state veterinarians and the various provincial state vets, as well as departmental officials, and the ICC, Dr. Mogajani, the DG, myself and others attend those meetings as well. So it is just to assist with the coordination, exactly as the Honourable Nkabane has said, that if we're going to coordinate this, it's going to require a cross-government and a cross-industry response. And so that particular triangle, and obviously took the lead on that from the President's model that he developed during COVID-19, where he had obviously had the MAC, and then he had the COVID Command Council that were feeding up into the presidency for the rollout of that. It was certainly a model that I felt would assist with efficiency, and it certainly is starting to pay dividends, as we're seeing with the rollout of cold chain assistance from particularly the MPO, RMIS, as well as the cascading of communication down to farmer level through AFASA, the TLU, and Agri-SA to farmers on the ground. Thanks.
Thank you very much, Minister. Dr.
Thank you, Chairperson. Minister has responded to almost all the questions. The few that I could add to Minister's response, Chair, you are correct in saying that the numbers that were reported in the previous presentations were more in terms of KZN and Free State. But I realized that, for instance, in the previous presentation, KwaZulu-Natal had reported having vaccinated 420,000 cattle, and we had only given them 500,000 doses. So I asked them as to whether it means they've got only 80,000. They still had more. They indicated that they had added the animals that they vaccinated with the BVI vaccine, as Minister explained, in terms of the 2 million that was done before. So to be more accurate and to account for the vaccines that we just received in terms of ARC, Dolvet, and Biogenesis Bago, we decided to remove all the previous vaccinations and only concentrate on the 3 vaccines. So that is why we seem to be having a lower number in terms of the numbers that we are reporting. But we are also trying to account for the vaccines that we have just used and just allocated. I don't know whether honorable members will understand that. So forgive us, please, for maybe confusing the two reports.
Okay. Members want to make a follow-up just there where you are now.
Yes.
Honorable Trolip and Honorable Aris.
Could I just also ask that the presenter speak closer into the mic so we can hear? I did ask for an explanation on slide 8, if you don't mind, because slide 8 doesn't deal with the issue around booster vaccination availability. And also we had an explanation last week in our interaction with the department about late payments to the vaccine producers, which was fine because it meant that they can now produce more or send more. But I also want to know how we're going to deal with timeliest payments in the future, because we had a hiatus where there was a delay in payment. So if we could have a specific answer around page 8, please.
Okay, Honorable Aris.
Yes, thank you very much, Chairperson. Chairperson, we have raised the question in terms of compensation for farmers that have lost the livestock. I didn't hear that any of the DG or the minister did respond to that question. Thank you.
Okay. I think yeah, Minister and DG and Dr. Matisan, you'll have to respond to these questions that are followed up. On the compensation part, I wanted to say, just to add, I was going to raise it at the end, just to say that is it not possible, given the fact that we have these challenges and it's something that was not considered probably before by the department, that given that we have these pressures from the farmers, that it is incorporated into government contingency plans, Minister, especially for dairy and pig farming sectors. So, as much as you may not necessarily have planned for it, my comfort is that you refer to the, references, you reference what was done during COVID-19. And therefore, I think that this question also goes along those lines, that during the COVID-19 companies were compensated at some point. So maybe you would like to just incorporate it into the contingency plan of government. And then just when the members were talking, they reminded me of a Minister of the Farmers who in the Free State, I can't remember whether it was in Paris or it was in Sasolburg, where they said, yeah, I think it's across the board in all the areas where we went, in all the municipalities where we went, where they spoke about the fact that their animals were tested, the blood tests, and the outcomes were not yet back, and they were tested in December. So my worry is, as you continue with the vaccinations and you still do not have the outcomes of the tests that were done, are you not worried that you may be, applying mismatched vaccines to these animals where you don't know the results of their blood tests? And then the last one, in the request that I made earlier on the collaboration with other departments, I'm glad, Minister, that you are raising the fact that we may want to bring Minister Nyons on the issues of land, that they can help you and help the communal people and the common age farmers, livestock farmers. I am thinking about, and honorable members would remind me, there's, I'm thinking about the these buffalo farms where they are farmers who have buffaloes, almost in close range with the ones that are cattle farmers or livestock farmers. How do you hope to be able to assist this? I think it was also raised by a farmers at the last meeting that we've had, and so it comes back to me to say, how do you hope to to improve the coordination, probably with the Department of what do you call it, forestry? I don't know whether you call it DFFE. Forestry, Fisheries and Environment, to manage the infected areas. I don't know whether you call them red line and buffer the yellow lines. You know it better. So I'm just thinking aloud, Minister, if there's anything you are doing there. And then on the last one, on the CSIR, DG, please help me. It must not be the ARC that responds to this question. In the last meeting, we were told that the DG is in communications and engagement with the CSIR, and I want to relieve the ARC because the foot and mouth disease now has been declared or classified as a disaster. So I want the department to respond from that level of yourself, Minister, and the DG and the team. Nyambos.
Thank-
Honorable Trolip, have you raised your hand?
Just on a point of clarity, I meant slide 9, not slide 8. When Dr. Morisani speaks to it, and also if he could just speak to where we are on producing 20,000 vaccines a week, the ARC, thanks.
Thanks, Chair. I'm just reminded by the Minister when he talks about the COVID-19 experience. Why are we struggling to manage the vaccine, this outbreak, when we had facilities that we had put up in place or established during the COVID-19 period? And there's a term, scientifically, they use repurposing of the COVID-19 facility and everything. Seeing that the Minister has adopted some of the strategies, your command centers and that, where are the facilities that we used during COVID-19? Can't we repurpose them now? Because like the issue of testing, we should be having mobile toolkits to test that are decentralized across the country. Because the centralization of the test results is going to cause a stampede, like exactly we were in Sasolburg when the gentleman raised the issue that from last year, they are waiting for results. Up to now, they are not yet out. An intervention is, I wrote here, mobile facilities. We should be adopting mobile facility strategy so that we go out into the people and then decentralize, come up with toolkits where you can test even at household level if push comes to shove. But we can't be stuck in one, without taking away from government. Within the government setup, you've got provincial department and regional offices of Department of Agriculture up to almost at a municipal level. But there must be availability of means, the tools of trade to do this. Then the issue of tax, Minister. There's a gentleman in Paris. He said there is a reverse exclusion or marginalization that is happening through this tagging thing, this F tag that is put on animals. Whilst it's appreciated, you put on tags, and then the veterinary doctor said, now they're no longer using that. But what is happening at auctions, when your animals have been labeled, then they get excluded for you to sell. And this is now causing an economic exclusion. Whilst we are in a disaster situation in terms of outbreak, we are causing another economic sabotage by the people who are already affected by this. And this is happening at auction. So which means there's another thing we need to be now looking up to. There are those who want their own animals to be sold and others not to be sold. So which means I must feed these animals, quarantine them, not sell them, and they are growing in number. We are creating another disaster. It actually is a secondary disaster we are creating if this is not addressed. Thank you.
Thank you very much. Oh, then there's an issue of the feeds, Minister, which he's reminding me of. I want us to finish because we still have 3 presentations, am I right, that are supposed to happen before 1 o'clock, because today we have a 3-line whip and we can be late. Honorable Aris, is that a follow-up?
Chair, now that this member mentioned, there was another issue that we have picked up, because some of the farmers did mention there in that public hearings that they take their animals to the auctions and then it's not get auctioned, but then there are other farmers that have the financial means that are now buying these animals at a very cheaper price because these people are really desperate, and because it's the only source of income and they are desperate to get money. How are we going to protect those farmers from not being, what do you call it? Van uitbuiting, extortion.
Don't worry.
Thank you.
The minister understood you very well. Yeah. Can we then go back to Dr. Matisane? You finalize, and then the minister will take those that he thinks wants to take. I don't know whether it's yourself, minister, and the DG. Oh, okay. Let's give Dr. Modisane to finalize, and then we'll go back to the DG.
Thank you, Chairperson. I wanted to also respond to the CSIR
Yes.
and other laboratories. It is a finding of the MTT that the ARC is overburdened, and they have
Raise your volume a bit there.
they have already identified several other laboratories that can assist the ARC in terms of the testing of the samples that they are receiving. There is, however, a small challenge, a big challenge, in that foot and mouth disease is a very infectious disease. We cannot give every laboratory the right to perform the testing, because they might spread the disease around the area. So the samples, all the samples have to be taken first to the OVR so that it can be decontaminated and made safe to be tested at other laboratories. That is a thing that is known as biosecurity level. So a laboratory that is testing for foot and mouth disease should be biosecurity level 3. So that is what is a challenge related to that. So it is true, Chairperson, that the number of reported cases that we are reporting to the portfolio committee may be lower than the number that other people have, because there are, even in our reporting, we indicated that Douglas was still a suspicion when we reported, and the one in the Western Cape too was also a suspicion. So they are also taking the suspicions and putting them in the list, whereas we are only reporting confirmed cases. So there's a difference between confirmed cases and the reported cases. The other question that I wanted to add onto what Minister has responded to, the CASP issue. After the previous portfolio committee, we went back to Gauteng to find out what is going on. Honorable Chair.
Members can't hear you. Please raise your volume again.
Really? The Gauteng Agriculture confirmed that they have not moved funds from the allocated CASP funding, but they have done an additional presentation to request additional funding for foot and mouth disease. So that is the confirmation that we received, that they have not moved funds from the allocated funds, but they have requested additional funding related to CASP. Honorable Trollip, that is the slide that you wanted us to respond on. Minister has indicated that we have already placed orders. The reason why I said that Biogenesis Bago vaccine may arrive anytime is because they have indicated that they have manufactured the vaccine and it is ready to be shipped. They were only waiting for an order from South Africa, and that order has been placed. With the other company, Minister has also indicated that there may be challenges related to the war in the Middle East, but again, there was a confirmation from Donavax that they may still have to manufacture the additional vaccine that we are looking. So that is the status of this one. Minister has also confirmed and emphasized the fact that 6 million doses, SAPRA has approved 6 million doses for Dolvet, but it has been agreed that it be exported in terms of 2 million batches. And then Minister has also indicated that an additional 5 million will be ordered from Biogenesis Bago. Those are the questions I wish to respond to. Thanks, Minister.
DG? Oh, that is right.
Honorable Chair, honorable members, good morning, Minister and DG. I think Dr. Milisan covered the matter that I think it keeps on coming from Honorable Mkidama. So just by way of background, in the CASP, the Comprehensive Agricultural Support Program, we have made 6% of the CASP towards so in the budgeting of CASP, provinces budget 6% for biosecurity. So biosecurity in this specific case would be used for FMD, plant diseases and related. So the discussions that happened during the workshop that the Gauteng legislature had revolve around the amount of 16 million, which then made this confusion. What actually happened is that the 16 million that was used was not moved from any other line in the CASP. It was allocated for biosecurity. All other provinces have that allocation. It so happened that MEC Ramokgopa, when she, I don't know at what place she was, what platform she was speaking, that when she was referring to this 16 million, it sounded as though it was shifted from other earmarked farming activities. It was not. It's an allocation that was already for biosecurity. This started, I think, the previous financial year, where we had begun to understand that we need to make available some funding within CASP towards biosecurity. So that's basically that one. The collaboration with the CSIR, meetings have already started. We engaged with DSTI and CSIR. My counterpart, Dr. Tenza at DSTI met. We had our initial meeting, and we're having our follow-up meeting will be in April. But I think the matter that we need to put before this August committee is that indeed there was a parallel planning. There are things that CSR can do in the biosecurity space, but FMD, as it's a trade-sensitive disease and it's also a very sensitive and it's spread easily, there are things that we would need to first agree with them, like Dr. Mlisan already spoke of, the deactivating the virus before it can go to any other laboratory for testing. It's not a case that you would have as we had with the COVID-19. Even if we were to have other laboratories, which we already have, they may not handle the live FMD virus or samples, because samples, then we don't know what is in the sample. In most cases, this will be live viruses, and we wouldn't want them to be handled at any other laboratories as you would have had with it. There are a number of laboratories as we can, but so far we had earmarked a few laboratories that are going to, also as you know, laboratories use what you call methods. So laboratories have got to develop specific methods to be able to test for FMD suspected or samples. So discussions are ongoing, and in our next meeting, we will have an allocated responsibility towards CSIR, and they will be able to report what is it that CSIR will be able to do. And there are still those that, unfortunately, Honorable Mteto, there are unfortunately things that, as far as the FMD disease or virus is concerned, you may not be able to have, for instance, a sample from Paré straight to a laboratory somewhere in Free State, because the virus, the sample still has to go to OBP, OVR for deactivation before it goes there. So it becomes to and fro. But as when the CEO of ARC will be taking the floor, if he has the slides, with your indulgence, I would ask him to share what progress we have already registered as far as increasing our diagnostic capacity. Amongst those is the relocation, temporary relocation of the laboratory technologists from the provinces to go and assist with the OVR in Pretoria, just so we can get the backlog sorted. In fact, there are numbers. I think we aim in less than 5 months to have cleared the backlog that we have at the ARC. So the peculiarity or the difficulty with FMD virus is that you wouldn't have any other laboratory handling it, that's as opposed to what we had during COVID-19, repurposing of existing laboratories. We do have, in fact, as members will remember, we use our mobile laboratories, mobile animal health laboratories, to assist Department of Health during COVID-19. Unfortunately, the reverse is not possible in this specific case. Other than that, I think others are covered. Yes, the rapid test, again, is the same. You wouldn't want any farmer anywhere else having in their pocket rapid test, because as you know, we need to report, we need to collate this information. The goal here is to eventually be able to have the FMD freedom without vaccination. And this data that we are collating is going to be become very important towards making our case later on. So this is a process, as members would have seen in our strategy. It's a staggered approach that by year 2, we want to already allow some provinces to be allowed to be qualify as to have freedom without vaccination. Western Cape is one of those provinces. Northern Cape is one of those provinces that, as things stand and the way we are managing the disease, we may earlier than imagined have them already released to become to be able to export animal products. So it's a carefully monitored process, Honourable Chair. Thank you very much.
Thank you very much, DDG. Honourable Trollip wants to make a follow-up. Just before you do that, Honourable Trollip, on the CASP issue, DDG, in the last presentation by the department, you actually had no specific targets on CASP because you were waiting for the provinces to submit. Now, if there are these challenges that comes from provinces and they have not been able to submit to yourself, it means we're going to have a problem going forward, because the question arises as to how are you going to assist these farmers, because these CASP funds are supposed to be in the provinces, and the provinces are not coming through with the plans to assist you, to assist us with the targets that you have in the provinces. I just wanted to raise that. Honourable Trollip.
Yeah, Chair, I'd like to go back to slide 9 because Dr. Morisane won't speak to the slide, and we've got to count on information that is sent to us by the department. Mm-hmm. Now, this report was sent to us by the department.
Yes.
And it has certain information that has not been spoken to today by the minister or anybody else. And for example, on biogenesis Bago, it says results outstanding. And it says waiting for SAT3 results reported to have arrived at Perbright. Now, I'd like to hear, what is the status of that? Why is it outstanding? When will it be addressed? When will we hear from Perbright? And then Dolvet, not yet received results, permit application will commence. That's not what we're being told. So can we please speak to that? And if it's wrong, correct it. Because there is a bit of confusion in this committee.
Yes.
Chair, there is confusion in this committee because we get told that we're doing certain things because of World Organization of Animal Health requirements. And then we discover that there aren't such requirements. And then we get told because it's not a registered medicine, but SAPRA have given Section 21 permits to import the medication. So it's difficult for us to join the dots if we aren't taken through step by step. And this is the presentation that was given to us, and I'd like the presenter to speak to it.
Yes, Minister.
Chairperson, I think it was made abundantly clear by Dr. Modasani when he spoke that the circumstances have changed since this presentation was shared, in that SAPRA has, in the last 24 hours, given the import permits for the Dolvet vaccine. It's very simple. There's not many dots that you have to join. You either import a medicine and register it under Act 36, in which case you don't have to go through a SAPRA process. Or, in case of emergency, you have to go through a Section 21 application. We have ordered 1.5 million from Biogenesis Bago. The Perbright results are awaited on the SAT3 in terms of that particular vaccine, but the efficacy that we've seen on the ground and through our use of it has already been tested and is showing the results that we need. Obviously, we require all vaccines in future that are imported to go through the Perbright process. And SAPRA is also requesting that Perbright process. But it's very clear what's happening here. We've ordered 1.5 million from Biogenesis Bago. We've ordered 6 million from Dolvet. That SAPRA process has been approved for the importation of 6 million from Dolvet, and the first 2 million will be being shipped to the country, and the 6 million, other 4 million will follow in shipments thereafter. There really aren't that many dots to join. May I also then just say that, and I want to deal with the Honourable Trollope's assertions around non-payments and late payments. And again, this is another manufactured state of fake news. I would hope that every member of this committee is familiar with the PFMA, which makes it very clear that government cannot pay in advance for products unless that we are able to verify what we've received and to make sure that what we have received is according to the order that we've placed, that they are counted, that they're accounted for, and then payment is released. And that's done for a very good reason. It's to prevent the situation we're seeing playing out in municipalities across the country where buses and trucks are ordered and the payments made and they never arrive. And there's a very good reason why the PFMA demands that of us. So no payment will be released until we have received the goods as were ordered, they've been counted, they've been tested to make sure that we're getting what we paid for. They are then logged into the system, and then payment is released. What happened with Biogenesis Bago is there was a mismatch in what was delivered versus the invoice that we required. The invoice was corrected, it was resubmitted to the department, and it was paid. And I would bet you anything you like that if we didn't do this, it would be the Honourable Trollope sitting here when the AG reports, picking us out for not having complied with the PFMA. So there's no such thing as late payments or non-payments for vaccines. It's a figment of people's imaginations. The PFMA has to be followed. I have a responsibility. The DG, as the accounting officer, has a responsibility to ensure that it's done, and we will continue to do so, despite efforts from those in this committee and outside who choose to create other narratives. Thank you.
Chair,
Thank you very much.
thank
Minister,
you. I still have an
before-
outstanding question, Chair.
You want to follow up?
Yeah.
Okay.
My outstanding question is around Biogenesis Bago. The results are outstanding. If we could just get some feedback on that, because that's what it states in the report. It's not a figment of anyone's imagination. But, Chair, I also think that it's not helpful for the Chair to the Minister to project what members will be doing in the future. We're here dealing with stuff that's live and a report that's in front of us, and I'm asking questions about that report.
Okay, Minister, before you come in, you know, I want to request that when members ask questions, please do respond to the questions without referring to members as problematic, and you have not said so, but it sounds like that. I would want you to respond to these questions without casting any aspersion to any member. But I also feel that if you respond in the manner that you respond, it's almost like you want members not to ask questions, and it cannot happen because you are here to come and brief us, and all members must feel free, you know, to be able to ask you questions and you respond to those questions. My take is that when members ask these questions, it's because they are interested in making sure that they oversight on the work that you do, and they are interested in making sure that the work that you do in the department, especially on foot and mouth disease, assists the farmers and everybody else out there that they represent as members of the committee.
Sure, Chairperson. It's very clear from there, under that there, that
Sorry, Minister, did you want to say something, Honorable? Okay.
That it cannot be that we as the committee must be subjected to, you know, people that want to score their personal scores here. They must go and sort out their things outside this meeting, because the way, and we need to be respected, because it can't be that we've been answered in a very, you know, manner that disrespect us, and that is totally unacceptable, Chair. Thank you.
Yeah, no, I have covered that. Minister, please.
Yeah, Chairperson, thank you. But I would say that respect goes both ways. And the honourable member's intervention earlier did not assist with creating the type of environment that fosters a very a process where I've committed to coming as often as I can to this committee, far more than any other minister accounts before a committee in this parliament. But if I'm going to do so, then the respect has to flow both ways. And the aspersions that have been cast through the way in which the questions have been put is that the department is incompetent, that I don't know what I'm doing, and that, you know, that everything's going wrong.
Minister,
And
they
I
have
don't
not
think
said
that's-
so.
Well, that's certainly...
Don't overread members' questions. If they ask a question, answer what they are asking for. Even if they have, you think that there is other things underneath the question, leave that and let's hear them raise it. You just answer the questions. But if you are going to want to read further into questions of members, and I've been listening to them, I think that they have been respecting your minister. So please do respect them.
Chairperson, all I said was that it would be, as we have seen in the last time AG reports have been here, and there have been issues where the PFMA was not followed, this department and this minister have come under heavy criticism for those. All I'm saying is that if I was not to follow the PFMA, that I've no doubt I'd be sitting back here when the AG's report is here and getting the same criticism. It is responding to previous criticism of the...
I'm sorry, Minister, just to disrupt you. There's a bit of a smell of fuel here. My chest is getting blocked. One of my staff members here has left because her eyes are now affected. So we've requested somebody to come and check here. So, yeah, we're smelling it here. I don't know whether you feel it, but my chest is now, you know, getting blocked, and my sinus is worse now. I don't, it feels like there's a generator fuel that's coming up. I don't know where it comes from. Okay, Minister, you can continue. I just wanted you not to be disturbed, but
It's very clear there. The results are outstanding on the SAT3 results from Perbright. You would remember that we came under heavy criticism before that we hadn't sent strains to Perbright for matching. We've sent strains to Perbright for matching, and those are currently being done by Perbright on the SAT3. However, we are satisfied that the efficacy of the Biogenesis Bago is able to meet our requirements, and we have placed an order for 1.5 million doses, which will arrive as soon as that SAPRA license is released. The Dolvet, again, 6 million are available. We have placed an order for the 6 million of the Dolvet vaccines, and SAPRA has, in the last 24 hours, issued the permit for those to be imported, and so the order's being placed. And that would be the 6 million that arrives then over the course of the next few months, and then the next month. And of course, then the Dolvet, the 1.5 million doses will be arriving shortly, and that will then be followed by the 5 million that we'd be able to get once the SAT3 results are out.
Okay.
I don't know if I can clarify it or explain it any simpler than that, or
no,
perhaps you want somebody else to explain it.
I think it's fine, Minister. Let's not go there. Please. It's not. I do request with due respect. You see, if communications DG and minister is not very clear, anybody who's taking information is bound to ask questions. But if you make additional info, for example, minister, you're talking about for the last 24 hours that SAPRA has, it's not there, it's not written. And so the members have a right to ask. And if they ask, please do respond to them with due respect, because there is nothing that talks to that 24 hours there of SAPRA. So I'm saying if you don't communicate well, we may miss each other in the process of you giving us information and us getting to understand what we want to understand. DG?
Thank you very much, Honorable Chair. And I think let me just depart on the very same point that has been under discussion for now, just to give clarity. I think for the purposes of the committee, the status of the permit that is being referred to is a permit in terms of Section 20 of the Animal Diseases Act. So once you have got a permit that is...
DG, go closer to your mic or pull your mic closer to you. Yeah.
Oh, let me just get closer.
There, that's better.
I'm just saying that it might be a question of clarity that is being in terms of the engagements. I'm saying the permit that we are referring to is a permit in terms of Section 20 of the...
Can you talk to Section 20 or 21?
Section 6 of the Animal Diseases Act.
Okay.
Yeah. Which then gives permission for the importation of the vaccines. Once SAPRA has given an authorization, there's a permit that should be issued by the department. And I think that's where the confusion at this moment is at, because that permit is a separate permit or licensing that comes from SAPRA.
Okay.
Yes. And I think we will make that point very clear in terms of separating the two acts so that it can be read differently.
Okay.
Chair. 4 issues that I would like to address, Chair, and pardon my voice, maybe it's because of the fumes also.
We hope not, because we don't have money to pay for.
One around the study that Honorable Nkabani was referring to. We will go back to the study, check the assumptions and the limitations of the study, and we will comment accordingly from the department side. On compensation, honorable members, Honorable Trolip had asked this question, and we had responded as a department in the very same committee. The first issue that we raised was that Section 19 of the Animal Diseases Act makes provision where an animal has been destroyed in line of controlling diseases, that we can then, the person can then apply for compensation at that particular level. We said this does not fit the current situation that we are having. And we are currently in discussions with National Treasury to see how do we deal with the losses that has been experienced in the sector, because it goes beyond the provisions of the Act, because the Act is prescriptive. It only refers to what has been destroyed in line of the execution of the task. And I think it was asked the other week when the committee was in Bloemfontein, and we had indicated that we are currently in discussions with National Treasury to deal with this issue that the chair has also asked, to say how do we respond to the environment where people have lost animals, and we are trying to address that. Honorable Aris, I think that's the issue that you had raised. Now, there was also an issue that was raised by Honorable Kebekul, and I think there is time where there needs to be a good reflection in terms of the current laws that we have in our country and compliance to those laws, and the instruments that have over time been eroded to assist us to deal with it. I mean, in the past, the Conservation of Agricultural Resources Act was used in broad terms, and the Fencing Act was also used to deal with diseases. At this moment, even in traditional areas where we used to have fences that would separate your cultivated areas from amadlelo, as it's called, is not being applied. And therefore, there's a need for all of us to revisit the current legislation that we have, the institutions that we had, including the traditional houses that we have, that dealt with the issues from that particular level to municipalities to just ensure that we enforce the different acts that are there. And as Minister has indicated, there is work that is being done to deal with this particular aspect. Now, there was an issue around the F branding that was raised, and I would like to go back to the point that was raised by Honorable Trolip, sorry for quoting you. But he had indicated one important aspect, that the implementation as we are having might be referring to an implementation where we had a different set of conditions that were existing. And that different set was dealing with FMD vaccination in a context where we still maintained the status. At this moment, we have lost the status. It means that Section 9 of the legislation needs to be changed so that we can deal with these other areas. And that change in terms of Section 9 is currently happening in terms of the consultation, currently in consultation, so that we can deal with issues like F-branding, because in the current situation, it would not assist because you are dealing with FMD that is currently being controlled through vaccination. The last issue, Honorable Chair, that would be raised was an issue around the economic impact of the disease. We have got a study that was done by BFAP on the economic studies. We have got a study that is currently being done by the National Agricultural Marketing Council. We took the presentation from the Agricultural Marketing Council yesterday on the impact. There are a few areas that they are still going to work on, and as soon as the results are out, we will come back to the portfolio committee to give that presentation that outlines the impact of the disease. What is great about that analysis that is being done by the NAMC is that it starts to also show impact economy-wide, not only in terms of agriculture, but what that impact means in terms of the economy, the impact to the GDP, the impact in terms of inflation, and other macro indicators that we have here. Thank you very much, Chair.
Okay, thank you very much. DG, Minister and Dr. Mendesan and DDG Sarache. I want us to go to the next item. I do appreciate that we have a very serious interest in the foot and mouth disease. However, we also have the same kind of interest in seeing the entities doing well. So I want us to go to the entities. Minister, we are going to start with the Agricultural Research Council Chairperson.
Good morning, Chairperson and members of the Portfolio Committee. I was watching the debate on FMD. In a sense, it's a major disaster, but in another sense, it puts agriculture on the map and it highlights what one can do. And so it was interesting that everything in agriculture, Chairperson, actually affects the lives of everybody in this country. And I think that's a realization that's really important for us to embrace. I looked at also the reporting, and we're almost at the end of the year, and we're doing 1 and 2. But I think it's important to track. And also when we come back, it will probably be the third and fourth, or maybe even the fourth and the final report, because the years for the ARC is done. I believe that what also was demonstrated this morning in the questions and the report back is that none of the organizations in agriculture actually operates in silos. And I think that was also important for me. We do touch each other. We rely on each other. And we have to support what is required in the agricultural sector. So, Chairperson, I would like to say that it's with pleasure that we take the report and we present it to you, and we do invite healthy debate on what the ARC has done and where they should improve, given the context of both the organization but also the industry. So I hand over, Chairperson. There was just one thing. I just want to make a clarification. The ARC is not OBP. Because often I see in the media we confuse the two. And I just want people to focus on the ARC. It looks and sounds similar to OVR, which is part of ARC, but OBP is not part of ARC. So I think we just need to keep that in mind when we present. Thank you very much, Chairperson, and the CEO will take us through the presentation.
Okay, thank you very much, Chairperson. All right, we've just been told, advised that the fuels are coming from the work that is done by the contractors, and there's nothing they can do about it now. We thought it was the ventilation that was coming from the side, so it's confirmed there's nothing. So we'll continue, and hopefully nobody's going to get sick here. CEO, please help me. We are at almost 8 minutes to 12. So meaning that we have only 1 hour, 8 minutes to deal with 3 presentations and 3 discussions. And the honorable members are not going to complain here because they are the ones who were very interested in the foot and mouth disease. I was on your side, CEO, and the other CEOs and the chairpersons, except the honorable members who really wanted foot and mouth disease. So please help me deal with the issues that are very important. These members have read the documents. I know that they already are waiting with their questions, so do that. And I want to advise that we're going to take that presentation from yourself. Members will note their questions. We'll take the second presentation from CEO Nkangweni and fresh from the box or new from the box chair as the second presentation, and then we'll take last CEO, the Perishable Products Export Control Board. So please, if anything happens with time, there is Lita here sitting there. If anything happens, you must know, you must blame him, not me. Thank you very much.
Chair, thank you very much, and greetings to the honorable members, Minister, DG, senior leadership of the entities. Thank you very much for the opportunity. I think during the previous debate, Chair, there were already a couple of questions that touched on the ARC, and hopefully during my presentation I can also help to maybe respond to those. Chair, at the outset, just to indicate that, of course, while we are reflecting as at the end of the first quarter of the current financial year, 71% performance at the time, we have already moved beyond what is being shared here, given that we are just a few days to the end of the financial year as we sit here. So there have been some developments, but at the time that we were sharing we ended the quarter, some of the items that proved to be slightly problematic included the ones that I have here on the screen in terms of the development of some of the systems and methods, production methods, the transfer of technologies often involves negotiations in terms of contracts with private sector partners and others, and sometimes it takes quite a while. It's not something you can be able to push on your own, even though we have it as a target. And then we also had KYD, which I can confirm that even though at the time the numbers were still very low, we have actually achieved the target since then. Some of the highlights to touch on, Chair, we had already at the beginning of the financial year demonstrated that delivery against targets when it comes to scientific publications was looking quite good. One of the challenges we have with this specific target is that we depend on editorial boards, some international, in terms of turning our papers around in good time, and sometimes we get to the end of the financial year still very worried about whether we are going to achieve that target or not, even though our scientists are doing their best to submit and keep within timelines. Of course, Chair, we have also at the time, at the end of the quarter, also had other targets that we did very well on that I have shared, including scientific services that we rendered through our laboratory network. Vaccine production, the one that we are talking about here, Chair, is the blood vaccines that we work on with OBP. So I will say a little bit more on the FMD one because I have a couple of slides dedicated to the FMD vaccine, and they are not necessarily about the quarter one and quarter two, because the idea is to keep the committee abreast of the current developments, and a lot has changed since the first and the second quarter of the year. I'll move quickly, Chair, again in terms of quarter two. Some of the problematic targets at the time were listed as on the screen, even though we had picked up in terms of the development of production methods. It was looking good, but it was still not quite at the target. You will see that we no longer had KYD here at the time, because then we had started moving a little bit in terms of that one, which was still behind during the first quarter, and a number of other targets that had actually progressed at the end of the second quarter include the work that we did, Chair, on the avian influenza and Newcastle disease screening, and that's what sometimes colleagues will say it feels like we are undertakers, because you have some of these targets that will increase significantly when there is an outbreak, even though you had actually planned to work towards a particular target. And we trained more farmers and we supported enterprises. In the next few slides, and I'm not going to spend a lot of time, we are sharing just some of the highlights during the period. By far, Chair, this is a very significant development that we had during the time, and maybe still fresh in the minds of others, that we hosted successfully in collaboration with the department, the Limpopo province, universities and industry partners. The Agriculture Research Council chaired the meeting of agriculture chief scientists with all the counterparts of the ARC from the G20 countries and invited countries, giving us an opportunity to share what South Africa is doing from an agricultural research perspective. We are very pleased that part of that work was actually invited immediately to be presented at the FAO in Rome by one of our senior scientists. Chair, there are other developments that with the constraints of time we may not be able to spend a lot of time on, but I think I'll stop just for 30 seconds on the orange flesh sweet potato. Is one of our favorite products. There's a lot of work that has been done, and we are now moving towards development of new products from an agro-processing perspective that are receiving a lot of interest with the communities and the stakeholders that we work with. Cassava is one of them, where we've actually reached a very critical milestone from a project that had started back in 2017 to look at cultivars that actually produce better starch in terms of cassava, particularly because this is also a crop that has been proven to be climate resilient in the advent of climate resilience. And this work was supported very well by the TIA. We have a number of events that we participated in and hosted. This is just one of them in Limpopo. In cannabis, there is work that is underway in terms of, again, just leveraging on the potential of cannabis. So technology includes work that has been done in terms of DNA fingerprinting and potency profiling of community cannabis land races. And this work has actually confirmed some of the unique genetic identities, and we are very proud of that work, and this because this adds value to industry in a lot of ways. We've also we're also sharing the work that has been done in mapping of smallholder farms using AI, which has been proven to be around 90% accurate, which is going to assist in terms of national strategy of agricultural development, making smallholder production quite visible in terms of how it's contributing. And there are a few others, Chair, which I am sure members have had time to look at around climate and agro-advisory decision systems, dairy genetics that are climate adapted, etc. Next generation livestock vaccine platform development. This is a nano particle-based DNA vaccine candidate for heart water disease that the ARC has been working on, and it has already demonstrated targeted immune activation, which is going to reduce livestock mortality and productivity losses, and also contributing to the national goal of biosecurity.
CEO, just wait. Why are we having all the mics on? Nhlanhla, something is wrong with the mics. Yeah, please.
Thank you, Chair. With FMD in the short term, as members would recall, we rolled out the 12,900 doses on the 6th of February. And it was the first time we were able to use this vaccine to deal with a live operational situation in South Africa during these ongoing outbreaks. And Honorable Trollip asked the question about the 20,000 weekly doses that we committed to. Yes, we are still on track to be able to produce the 20,000 monovalent vaccine on a weekly basis. I must emphasize, Chair, that this process is not without its challenges, because it's like producing while also upgrading the system at the same time, and it adds to a lot of complexity. And this, because this is an evolving situation, we have prepared our system such that we are able to respond to the evolving epidemiological situation, such that if we need to add more strains to the formulation, that will add perhaps another week in terms of timelines, but we will still be able to produce for what is needed to deal with the current outbreaks. In the medium term, we are steaming ahead with the upgrade. As I said, this is ongoing work in terms of looking to multiply the current capacity to be able to upgrade it from the current 200-liter mid-scale system to 1,000 liters, and that work has already started, and we are projecting over the next 12 months while we are producing in the background that we will be upgrading the system, and that's why we're talking about this being a very difficult time for us to be able to do this. In the long term, we have shared that yes, the building of the fit-for-purpose facility that will give us up to 20 million pentavalent doses annually is still underway. The designs have been completed, and the designs comply to the World Organization for Animal Health regulations, biosafety and biosecurity regulations, GMP regulations, local regulations for preparation of veterinary biologicals, as well as good engineering practices. Once we have secured the funding, there is a projected timeline of about 24 to 30 months to be able to build, fit and test towards commissioning of the facility. Vaccine production is not the only thing we are doing, Chair, during the FMD, and I think this FMD outbreak, we are providing diagnostic services. I think there was already a question around how we are improving the capacity given the backlog, because we are dealing with an unprecedented number of samples since the outbreak started. And this is a very crucial part of monitoring the circulating strains. So we've already started the process of fast-tracking additional skilled personnel to be onboarded in the next week or so. Some of the people are starting already. There was a process of interviewing a lot of people. I think the first 10 is starting in the next few days, and there is another 30 that is expected to join the facility so that we can chip away at the backlog. I think Dr. Mudisane said we are looking at maybe the next few months, the projection from the colleagues that are running the laboratories that by the end of May, we should be back to normal timelines. So we are doing everything to get to that target. We are also installing additional equipment to increase capacity, particularly for serology and molecular diagnostic testing. And we've also heard that we are now plugging in, looking at 4 laboratories have already been identified in different parts of the country that are going to add to this capacity. But the ARC has to then assist in terms of integrating them through a very specific workflow that process that we are managing quite well. The other thing, Chair, to share with the committee at this point is the progress that has been made on the commercialization entity of the ARC. We have, with the minister's support, now moved to the next stage after the minister has signed off. National Treasury is going through its own processes in terms of, taking this to a level where we have a fully fledged commercialization entity. And we are very pleased because this gives us an opportunity then to be able to do more in terms of commercializing ARC intellectual property and other forms of property in the ARC. So thank you, Chair. For the remainder of the time, I'm going to invite the CFO through you to take us through the financials and a little bit on the audit improvement plan. Thank you, Chair.
Thank you, Chair. So I'll just quickly rush through it. The slides are in the presentation pack. On the income statement, just to say that unlike in previous years, this year we are ahead of schedule as at the end of September with regards to our external income. And that has resulted in a better than budgeted surplus for the year, for the period ended September 2025. Projections are still that we will achieve the 1.1 billion in external revenue, and we haven't adjusted our targets for the end of the year. Committee members and colleagues are drawn to the attention that our operational expenditures were lagging a bit behind because of some of the delays in procurement, and our personnel costs, although higher than budgeted, were as a result of contract positions we were filling to make sure that we meet the deliverables of the SLA with the department. That's basically the summary of the income statement. The balance sheet, there is a bit of a out of sync alignment here because of the fact that our cash flows are a bit under strain. We are busy engaging with the department to resolve some of those issues around some of the payments for the SLA. But other than that, from a solvency and liquidity point of view, the ARC is in a very healthy position. I'm not going to talk to the cash flow statement. I think the only other thing I'd like to bring to the attention of the committee is the issue of the audit improvement plan. So after 7 years, we did manage to get an unqualified audit report last year, and we are steaming ahead with our AIP, which we presented to our Audit and Risk Committee, and we are sticking to its deliverables. We've done, again, 100% verification of fixed assets on the new NetTrace system and the Sage new ERP system, which we implemented last year. And that was the main reason for the qualification. Other than that, on the matters of emphasis paragraphs that we received on the GRAP implementation as well as on the irregular expenditure, we are working closely with our internal audit to ensure that all those gaps are covered so we can move towards an even better audit outcome than we achieved in last year. And finally, just to say that last year we had an issue with the AG where we actually challenged some of the findings. So this year, in an effort to overcome such issues, we are having a more earlier engagement with the AG's team. We actually did share the audit strategy and the engagement letter with our Audit and Risk Committee some 2 weeks ago, which will be signed off by the chair of the board, and we are hoping to have a much smoother audit in the coming year. Thank you, Chair.
Thank you very much, CFO and CEO. You can move the chairs and go to the other side, and let me bring in CEO Ngangweni and the chair. Let's allow you to greet the honorable members here and introduce yourself. You have not been introduced formally, but please do.
Thank you. Thank you, James. Am I audible?
Yes, you are very well.
Sorry, are they actually going to come back to take questions?
Yes, they will come back for the question. I said we must note, so that I'm looking at the time, so that we ask all the questions and then they will respond at the same time. Yeah. Okay.
Yeah. Good afternoon, Chair. I had good morning on my little notes here, but it seems good. We had a good discussion. So thank you, Chairperson, Honourable Minister, DG Ramasoli, DDG Sekauchi, and also other members of the Department of Agriculture, Chairperson, CEOs, CFOs of the other SOEs. It is quite a privilege to be appointed as the Chairperson of the NAMC. I'm not completely unfamiliar with the organization. I've been in a similar room in this building 17 years ago, during a period that the world was also experiencing significant challenges, but those were not geopolitical challenges. Those were the global financial meltdown in 2009 when we had previous chairperson of council, Angelo Peterson, and the two colleagues that I will introduce a little bit later on, for the really hard work that they have done over the last 2 to 3 years, because the NAMC did experience some challenges, and they were able to resolve those, and they will talk to them. Somebody that, sorry, I should have mentioned that somebody that I do remember from the previous portfolio committee that you might also remember is Abram, that added significant value also to that committee. So I think for the sake of time, let me introduce my two colleagues, Dr. Simpiwe Ngqaweni, CEO of the NAMC, and Ms. Lebogang Dire, the CFO, that will lead the rest of the discussion. Thank you.
Thank you very much, Chair. Dr.
Thank you very much, Honorable Chair. Greetings to the honorable members, to the Honorable Minister, DG, senior leadership of the department, and the entities and colleagues. Thank you very much for the opportunity. I'm going to try and save some time, Chair. I'm going to run through the presentation quite swiftly. Hopefully, I will not miss significant issues, but the members have the presentation details. So thank you very much. So maybe just to preface the presentation, Chair, I think just a reminder that the NAMC's mandate, as enshrined in the Marketing of Agricultural Products Act, says that we're responsible for overseeing statutory and other regulatory measures, as well as providing advisory services to the Minister and other directly affected groups on agricultural marketing policy. So the outcomes that we will report today are basically based on these two areas of our mandate. Most, as the members will see, most of the outcomes and indicators have got to do with the reports that report on what we have done to basically, or produce to basically provide advisory services, as well as coordinate some regulatory measures within the sector. I'm not going to go through those broad objectives of the Act. For the sake of time, the vision and mission is also quite aligned to what the Act says. I think this is an old picture, but it did apply during the period that we are reporting. These are the council members that were in place at the time. As you have heard from the chair, there's now been new members appointed, and we appreciate the guidance from the council. The executive management hasn't changed. I'm just going to run through some of these slides. I'm going to get straight into the performance, the non-financial performance for the organization for Q1 and Q2. We've consolidated the outcomes, Chair, for both quarters, and the slide in front of you is a summary of those outcomes for both quarters. So we've got 3 programs under which we report, and as the members can see, we've managed to meet the targets in 2 of the programs, and in the 3rd program, we managed to exceed our target, and I'm going to get into the details just now. In terms of program 1, the highlight, Chair, is that, as our chairperson has indicated, there has been an improvement in our audit outcome from a qualified audit when we experienced challenges, especially in our finance division, in terms of capacity at the time. We've now turned the situation around with an unqualified audit report with findings, which the CFO will talk to. In terms of program 2 or outcome 2, as indicated, all of the indicators there have been achieved during both quarters. And this is just a detail. The table there is a detail of the specific indicators that we're referring to. I'm just going to jump that. These are some of the reports that I was referring to earlier, which ground the work that we do as we advise the minister and other directly affected groups. These are just some of the reports that we are referring to. In terms of outcome 3, where I had indicated that we exceeded our target for both quarters in a consolidated manner. This refers to the farmers that we link to market every quarter. we have a target of linking 30, at least 30 farmers to the market. For 2 quarters, that basically works out to 60, and we were able to take that figure up to 155 due to successful collaborations that we've been able to forge with some of our partners in the province, both in the public as well as the private sector. I think the table just goes into the detail, and I'm not going to get into that. Now, I'm going to go through, just before I give over to the CFO, some of the topics when we refer to policy advice. These are some of the topics we've been able to cover. For example, the issue of rising energy costs, the issue of AGOA. We are also doing an analysis on the possibility of a vet-free chicken meat and what are the implications for food security in South Africa. We've also covered the issue of the EU regulations on the South African citrus industry, the issue of the USA reciprocal tariffs on the South African economy, the impact of that, of course, the ongoing Russia-Ukraine war, and other topics. The DG earlier indicated that we are also currently working on a study looking at the economy-wide impact of the FMD challenges that we're currently facing. I'm not going to go through line by line there. Chair, I think as I've indicated, the highlight in terms of our outcomes has been the movement from a qualified to an unqualified audit opinion, and the CFO is going to elaborate on that. Chair, I also want to indicate that as part of our advisory services to the Minister, based on a request that we received from a directly affected group in terms of our act, we've been able to advise or supported the inclusion of indigenous crops and medicinal plants into the list of products declared under the Marketing of Agricultural Products Act, and the Minister has approved that request, and this is bound to have an estimated 12 billion rand per annum injection into the agricultural economy. So this is a positive aspect that we can look forward to if implemented successfully. I'm going to jump some of the pictures just to indicate that some of the members may have seen some of the interactions that we have in the media on various topics. So those are some of just the pictures there. CEO Maginga has indicated also the issue of participation in the G20. We were also quite active as the organization. We gave quite a significant contribution towards the text under the Agricultural Working Group, as well as the Food Security Task Force, which has gone into the final declaration by the heads of state. So we're quite pleased with that. Chair, I think let me now give over to the CFO to take us into the financials.
Thank you, CEO. Let me just get to the finance report first. We are reporting the financials as at Q1, where we were sitting at a total available budget of 73%. That is against a budget of 51.8 million, where the actual spend for that quarter was 14 million. As you'll see in the presentation, we monitor our expenses based on the 4 categories, the salaries, admin costs, professional services, and then also the capital expenditure. If you can move to the next slide. Then moving to Q2, where we then were measuring ourselves against an adjusted budget of 62.4 million. That adjustment is as a result of the funds that were committed in the previous year to previous projects that was then rolled over into the current financial year after approval was received from National Treasury. With that, we were then at, can go back a bit, 55% as at the end of Q2. That is with an actual of 28.1 and an available budget of 34.3. Then on the last column there, just to give some forward-looking information, as at then the end of Q3, we were then 32%, had available 32% of the overall budget. This is just to indicate that we monitor our budget. Budget monitoring and control is a daily, weekly, monthly process just to make sure that what we do have available is spent responsibly and within the available resources that we have. Can you move to the next slide? Then jumping to the audit recovery, the CEO has indicated that we managed to move from a negative audit outcome to being unqualified, although we had findings. This just depicts the movement in findings. As you'll see, members, that we had quite a huge improvement, especially around the financial area, where we had most findings in the previous financial year. We can move to the next slide. So in terms of our audit recovery plan, this we developed after the finalization of the audit, where we monitor all the findings that were raised by the external auditors. As at the end of Q2, 62% of those recommendations were implemented, where we had 38 then partially implemented. But as we sit now, over 90% of those are actually implemented. And this is also verified by the internal auditors on a quarterly basis and reported on at the Audit and Risk Committee as well as Council to ensure that we keep on track with the resolution of these findings, and most importantly that we don't have repeat findings come this 25-26 financial year. So as a part of us ensuring that we are gearing ourselves up and working towards a clean audit, we have had our kick-off meeting with the external auditors for them to start the interim audit, because we saw in the previous financial year that's actually one of the interventions that assisted us to move from the negative audit outcome is the early working together early on with the external auditors, so that if there are any issues, we can then remedy those before the finalization of the reports. So, yeah, this is a work in progress, but we are working with all assurance providers to getting us to the final reports as at 31st of May. But then also looking at the root causes, where we had reported that we experienced those challenges because of vacancies, especially in the Finance and Administration Division. We did have challenges. We did, we managed to close the manager financial reporting position. However, we are still struggling a bit with the management accountant position, largely due to budget availability, but we are working very closely with our HR division to look at strategies to attract and most importantly retain people, especially in these positions. Then looking at records management, as at the Q2, we were still talking about the process being implemented, but as we sit now, the system is fully live. We are now digitizing our processes and our records such that information is easily retrievable, and when being requested by the auditors, it's a matter of then just downloading and submitting to the auditors. And then with these interventions, we're hoping that we will see an improvement in the audit outcomes for the 25-26 financial year. Over to you, CEO.
Thank you, Honorable Chair. I think that brings us to the end of our presentation. Thank you.
Thank you very much. Please do exchange seats with the PPECB. Are you orphans? You don't have parents, do you? No. Okay. Okay. Minister, did you want to say something? Okay. Oh, yes. Yeah, okay.
Hopefully,
Okay, Sino, go ahead.
Thank you, Chair. Good afternoon, Honourable Chairperson, members of the committee, Minister, colleagues. Thank you for the opportunity to present the PPECB's Q1 and Q2 annual report. Performance report. I'm a couple of months too early.
We wouldn't worry also.
Chair, just an apology on behalf of our chairperson, Mr. Anton Kruger, who cannot be in attendance today. So just an official apology from his side. Thank you, Chair. I will try to make up time, as all the other members have done so. Chair, just in terms of the total pallets exported for the period under review, the PPCB has monitored 3.9 million pallets that was exported in 2025. If you compare to the same period in 2024, it is a 5.2% increase, so a definite increase in terms of pallets exported from a South African point of view, and that's mainly driven by the increased number of citrus that we have seen had record exports in 2025. In terms of the movement of fruit, the European Union remains the biggest exporter or the biggest importer of South African fruit, sitting at 37%. The Middle East in particular, 16%, and I will elaborate a bit on the Middle East. Asia, 15%, and as we can see, North America, Russia, around 7 and 9%. Chair, in terms of the situation in the Middle East, we are obviously concerned, and we are watching it closely. There are various initiatives that the PPCB is involved in. I can, however, report that if you compare the exports during March of 2026 to that of March in 2025, we have noticed an 80% drop of exports to this region. We have noticed that exporters are mainly diverting their produce to other markets that is of an equal or higher standard or lower standard that can take this produce. So the PPCB is definitely with the Department of Agriculture assisting exporters wherever possible. In terms of the human resources for Q1, the PPCB is mainly driven by seasonal requirements. So we do have a high seasonal or temporary employee staff complement. In total, we've used 1,241 employees during that period, of which the majority, and that's 51%, were temporary employees. For Q2, the situation has changed slightly. We've used 1,154 employees, and that was basically as the citrus season have toned down, and the majority was therefore permanent employees, which we have relied on for the services delivered. In terms of the Q1 and Q2 organizational performance comparison, during Q1, 4 out of the 14 key performance indicators were not achieved in full, which gave us an achievement rating of 71%. The situation has improved during Q2, or I should say at the end of Q2, with a 93% achievement rating, of which 1 out of the 14 key performance indicators were not achieved in full. The one indicator that was not achieved was the number of customers that we've onboarded in terms of our data exchange platform. We called it Intelex, where we fell 4 customers short. We are, however, confident that at the end of this financial year, we would have caught up with that, and all efforts are being made to ensure that we do achieve the target. Chair, with that, with your permission, I am going to hand over to our Chief Financial Officer to take us through the financials and the performance or the audit plan. Thank you, Chair.
Thank you, CEO. CFO, go ahead.
Afternoon.
Yes, afternoon.
Okay. So starting with Q1, PPECB began the year quite strongly. Revenue for Q1 was 210 million rand, driven primarily by strong citrus export volumes. On expenditure, we spent 174 million, which is 83% of Q1 budget, reflecting continued cost discipline. The quarter closed with a surplus of 36 million rand. Moving to Q2 and the first half year, total income reached 479 million rand, which was 101% against budget. Citrus remained the main revenue driver. Maize volumes continue to underperform, and we are monitoring this quite closely. In terms of total expenditure for the 6 months ended, it was 357 million rand, or 88% of budget. We therefore report a half-year surplus of 123 million rand. This surplus is seasonal, and if we look at Q3, it did reduce, or we would say normalize, during the quiet period after the citrus season had ended. But overall, the PPECB's financial position remains stable, and we have no material concerns that we would like to raise to the committee at this time. Turning to governance and compliance matters, PPECB achieved a clean audit, and therefore no audit improvement plan is required. I think that deserves a moment of silence, Chairperson.
No, it's a moment of clapping.
However, we did have limited instances of fruitless and wasteful expenditure and irregular expenditure, all of which we have detected, we've disclosed, we've investigated, we've addressed, and corrective controls have been implemented. Chairperson, you will recall that you requested feedback, in particular around the SARS VAT penalty matter, which dates back to July of 2024. We have ensured that going forward, we do not have a repeat of this. However, we have now followed all available admin processes, including an appeal, repeated follow-ups, and we even then considered third-party support. We have unfortunately reached admin finality without resolution, and any further activity on this matter would just cost the PPECB unnecessary funds. We have strengthened our controls by ensuring that payments are now scheduled to reflect on a weekday and not on a Saturday, and the board has condoned this value. So we therefore take the matter as now condoned and concluded from the PPECB. With regard to the irregular expenditure, there were two matters that we reported. In both instances, there was no financial loss to us, and the matters were assessed and condoned. We have applied balanced consequent management, and we have strengthened our controls. I think that's it from my side. Thank you.
Oh, thank you very much. CFO?
Chair, thank you. That is then all from the PPECB side. Thank you.
Okay, thank you very much. Colleagues, let me just first say thank you very much to all the CEOs and the CFOs for the presentations. We are now going to take questions. So as you forward your questions, honorable members, may I request that you indicate to which entity so that they can make notes in order to be able to assist you to respond to the questions. Honorable Trolip, Honorable Aris. Honorable, okay. Again, let me do this. Mthethwa, Tama and David. Honorable Trolip.
Thanks, Chair. I asked a question to the department when we were in oversight in the Free State around the ARC produced vaccines that were distributed on the 6th of February. And my questions were around when they were manufactured. If we aren't manufacturing vaccines now, when was that batch manufactured and what the batch numbers were? And the DG said that he would get the CEO of the ARC to respond to this question. And the question is related to my question around, will we be able to produce 20,000 per week? And if we haven't produced them yet, when were those vaccines that were distributed produced? So that's my first question. The second question is that we note the improvements and in training and publications and hosting the G20 by the ARC and the unqualified audit. We want to commend you on that. But the target of vaccines production in the report was that there were 72,095 vaccines produced as opposed to a target of 30,000. What vaccines are those? And then, Chair, my question to, I'm not sure whether it's to the NAMC independently or the PPECB, but I think it's applicable to both. We note that the EU is our biggest market for the exportation of citrus. But the EU continues to set prejudicial phytosanitary requirements against our citrus. Has there been any advancement in dealing with those prejudicial phytosanitary requirements, especially related to FCM and CBS?
Okay, thank you very much. Honorable Aris.
Yeah, thank you very much, Chairperson. My question for the Agricultural Research Council, the Smallholder Farmers KYD program. I noted that the ARC failed to meet the Q1 targets of supporting the 1,500 farmers that did not report and did not report in Q2. That's on slide 2. I want to find out what is the actual number of farmers supported to date and why was Q2 performances not reported? And then what operational or resource constraints led to this underperformance? And then also what corrective measures or action or timelines are in place to recover these shortfalls? The ARC cited limited staff capacity as a reason for the missed targets. So we would like to know what is the current vacancy rate in this critical, units, and why is the ARC not proactively addressing capacity gaps earlier, especially in commercialization and licensing unit. And then also the ARC achieved 0 out of the 3 planned IP registration and 0 out of the 6 technology transfers. So what are the root causes of failing of meeting these targets? And then, yes, I have a lot. How many of the missed targets
What
are
did you
they
say?
referred to?
Honorable Aris.
No, I'm just, Chair, sorry. I'm just check the time because I have so many questions for them.
I'm worried about my
Yeah,
time.
I have so many
because I don't
questions,
have a
but I
dog
think
here.
I will also write some of them. I will leave the ARC now. In terms of the NAMC, Chairperson, I noted that, and I'm not sure, I need some clarity, that this, the presentation did not reflect the newly appointed council. Are they a newly appointed council? Because as far as I know that in May 2025, the NAMC council term has expired. So, and I don't see that they mentioned that there's a newly appointed council members. Then also, what progress has been made to enable the NAMC to implement programs directly rather than only advising, and what are the barriers?
Yeah, you may want to give
Relationships,
others.
yeah.
Let's give
And what
others
is
a
the current position of the feasibility assessment of introducing a once-off transformation levy? And then for the PPECB, that is regarding the crisis in Cape Town container terminal. What was the extent of the PPECB operational disruption and how did it affect inspection and certification services? And why was there a report shortage of the PPECB personnel during peak export seasons? And what contingency plans were in place and why did they fail or prove insufficient? And then also what is...
Honorable Aris, let me
Can
just help here. I want you to ask these questions, but I also want you to give an opportunity to others because, and beyond that, I want you as honorable members to give
Chairperson,
the
what I
entities to
will do
respond.
is I will, because I have quite a number of questions, I will
come
put
back
it
for the second
in
round if we
writing.
have time,
I
yeah.
will put it in writing or I
Please.
can come back. Thank you.
Please, thank you very much. Honorable Ndalane.
No, thanks, Honorable Chair. Let me welcome all the 3 presentations by the entities. And on the ARC...
Closer to the mic.
On the ARC, what specific measures is the ARC taking to address the unachieved target in quarter 1? And what progress has been made in resolving the asset register issues? And what is the timeline for completion? And then how does the ARC plan to improve its financial sustainability given the declined external revenue? And then the NAMC, how do NAMC collaborate to support the agricultural sector? Are there any plans to expand the agri technologist program. Thank you, Chair.
Thank you very much, Honorable Ndalane. Nyambos, ungisize now if we don't have time at all.
Thanks, Chair. To NAMC, is it Marketing Council with PPECB, Perishable Product Export Control Board. I once asked you a question, whether do you know to distinguish the origins of some of the products that ends up at the harbor going for export in terms of demographic parity contribution. The reason why I'm asking this question, it is linked to a question to the Marketing Council, seeing that you are doing some footnote or studies or research. FMD has exposed the fault line in the agricultural sector whereby issue of land was actually downplayed in the agricultural sector. FMD is exposing the fault line that you need quarantine facilities, you need grazing land this time, and it is not part of your line function. How do we then advise the department to restore the debate of land in the agricultural sector as a study that you need to give South Africa? Then in terms of ARC, are you managing the disease or you are eradicating it? Because every time you come up with vaccines, but FMD is problematic economically. We should be talking eradication. You are still at your baby stages of finding vaccines. So where are you playing? Are you managing it or are you eradicating it? And if you do, how do you do that? Two, where are early warning signs? You always hear that flu is coming as we are approaching winter. You are able to project. But in this case, you are caught with your pants down. And now you are reactionary. You don't have stock. We have to go outside to...
Honorable Teto, I hope not, that which you just said.
Okay, fine, Chair. But
use another language.
Okay, I understand. Let me leave that train of thought altogether. On Marketing Council, I wrote here, we need a measured approach, an intentional approach in the issue of market access, demographically speaking in South Africa. Because we saw during this FMD, where we are competing for space in terms of market, but you then find that there are limitations based on labeling that is done in the agricultural sector, which ends up manifesting badly demographically where certain quotas are not allowed to sell or deliberately sabotaged not to be able to sell to allow others to sell. And that is a problem. Thank you.
Thank you very much. Honorable
Matam. Thank you, Chair. I see here in the Kaunafatso ya Dikgomo, initially we were told that they did not meet the target, but we were just now informed that that target has been met. Chair, I just want to appeal that in future we get complete documents in time so that we're able to make contributions here. We are not ambushed by an updated information. Then there is the targets of training, which was set at 140, and we are reported that 609 has been met. This concern goes also to the NAMC, where 120 small-scale farmers have been targeted. You know, Chair, it's my perennial problem. We know that there's about 2 million, probably and a half, small-scale farmers. But when we plan at this small-scale level. What impact is there going to be likely to happen in the sector? So we really need to think about how we plan. Are we planning against reality, or we just arbitrarily decide, okay, 50 here, 100 there? How do we come to determine these values for targets. For the PPECB, just to ask the question of what is the percentage of small-scale farmers' contribution to the export processed? And if possible, can it be broken down by income? So if we check the income that large-scale farmers get from exporting through your processes versus the small-scale farmers, it's a very impressive triple BEE achievement of 96%. But again, I want to check in rands and cents, what are we talking about? What is the actual quantum of money that goes to black economic empowerment? Again, only 110 small-scale certifications. It's my question that we are planning at a very low level, and then we claim to have achieved something, but we are not doing anything in terms of large-scale reality out there. Thank you, Chair.
Thank you very much, Honorable Tama, Honorable David.
Thank you, Chair, and I also want to welcome the three presentations. My first question is to the ARC. How is the implementation of the ERP system impacting the ARC's operations? What strategies does the ARC have to improve its collaborations with the external stakeholders? Then my question to the PPECB was asked by Honorable Aris. My one is the total of seasonal workers that you have. Are there any skills transfer to those that you said is not skilled? And do they, in these times that they are seasonal workers, they become, maybe one or two become permanent workers? Then my question to the NAMC is on your markets. I want to know with this war that is going on, what impact negatively or positively does it have on our country? Thank you.
Thank you very much. Who do I start with? Let me start with ARC. ARC, you were the ones who started with the presentations, am I right? So I would like to allow you to come through for the responses. Chairperson, do you want to start, or we give directly to the CEO?
Chairperson, I'm going to give directly to the CEO, not to waste any
All right.
time. Thank you.
Thank you very much, CEO.
Thank you, Chair, and thank you to the members. Chair, maybe just a little bit on the process of vaccine development. We've had we actually issued an explanatory note with a lot of detail because at the time that we rolled out the batch on the 6th of February, there was a lot of confusion that we picked up. And so 5 days later, we actually issued an explanatory statement where we explained that the process of vaccine development is a cumulative process, and for the vaccine that we are working with now, this is the vaccine that was indeed registered back in 2022-23. But registration does not mean then you have a ready-to-deploy vaccine. So there were still processes that were undertaken to get it to a stage where it could be deployed, particularly in dealing with the current outbreak. So when we put the targets that you see on the APP that are talking to that quarter to Honorable Trollip, we were still talking specifically about the blood vaccines. So later in the year, where we got to the stage now, after we rolled out the vaccine, we are actually looking at how to incorporate the FMD. So it wasn't part of the plan. The scientists were not even sure at the time that we would be able to have where we are, because even the mid-scale system that we ordered now that is going to give us the 20,000 was not even fully installed at the time. So now we've just completed the installation of the system, and that's what we are looking at in terms of rolling out the 20,000 that we've talked about. And we are still, as I sit here, confident that we will meet that target. And as I explained also during my presentation, the epidemiological situation is, of course, evolving. We have to produce for what we need as a country. So we are taking cue from the department, from the ministerial task team, in terms of making sure that we align and respond appropriately with our limited production capacity, which we are upgrading over the next 12 months. To Honorable Aris's question regarding KYD, maybe I need to clarify. I didn't say there was no target for quarter two. I said it has disappeared from those that were not met, because we were able at that time to then catch up on it. That slide only shows the ones that were not met. And the reason that the figure was low in quarter two was because we are in the process of modernizing a system which we call Intergis. And at the time, the Intergis, and some of the honorable members may be familiar with it, the configuration of that system and modernization of that system was not at the stage where we could do everything at the time, and the functionality for accommodating the services that are rendered to the farmers were then subsequently updated in order to capture all the services as it was provided in quarter two. Then regarding the diagnostics, as I have indicated in terms of the laboratory, we are fast-tracking the addition of staff that are registered with SAVEC for specific roles in order to drive the backlog down as quickly as possible. And we are winning because following a process of interviewing many people, we know that the first 10 are starting at the end of this month. The registration and transfers of IP, unfortunately, even though we have this as part of our mandate, there are processes that sit outside the ARC. They have external dependencies. So we don't register the IP ourselves. We have to send it through a process of registration through the department, and transfers also depend on external parties negotiating contracts and for them to be happy with the contract so that they can contract and take the ARC IP further. And so sometimes those processes do take some time, because in their very nature, contracts sometimes do take some time. Honorable Ndalane, on the asset register, I think we have actually, the CFO indicated when he was presenting, we have actually gone back to our 80,000 plus lines and verified each and every one. So we've done another 100% verification of our assets to make sure that as we go into the audit this time, we go with confidence that that part of work has been done. Members would recall this was always the Achilles heel at the ARC and led to this continued audit qualifications because of the this asset register and the wide distribution of assets and facilities across different parts of the country, and that gave challenges. But we, as we have demonstrated even last year, that we were able to now, using technology that we have adopted in the course of last year, that has helped us in retaking the asset, but also being able to track assets when they move, in order to make sure that through NetTrace we are able to know where the assets are, and that is going to help us in a long way. And regarding the external revenue, Honorable Ndalane, actually it has improved significantly. So while we are still looking at the additional benefits that will come with the registration of the commercialization entity, the external revenue that we have now is much better than we've had 2-3 years ago. So it's looking better than it has. But we are indeed continuing to look at how we diversify our external revenue sources to contribute to a more sustainable, financially sustainable institution. Honorable Nyambose is asking very important questions around the management of the disease and the eradicating of the disease. The World Organization for Animal Health has something called the progressive control pathway, which has different stages that you go through as a country in terms of where you are in managing the disease. And right at the end, you have the FMD-free status, because that's the target. It's the FMD-free status without vaccination, and there's FMD-free status with vaccination. It has taken, and this is one of the examples that are touted even by the World Organization for Animal Health. It has taken Brazil about 20 years to get there, to FMD-free status without vaccination. The country is moving towards FMD-free status with vaccination as part of the national strategy, and that's why we are talking about, when you listened earlier to the minister and DG and colleagues talking about vaccinating the entire national herd. Ultimately, what you need to get to is the FMD-free status. That is the first prize. And then you can say FMD-free status with vaccination, but ultimately you have to get to without vaccination, and it takes a long time. Yes, even the national strategy is talking about at least 10 years for us to be able to get there, more or less. Honorable Mtama, maybe it's again just a slight clarification. When I said it's when it's not met on the slide, and then I went on to say, however, it is now met the target on KYD, is just to give assurance to the members that even though the picture that we are presenting today is as at Q1 and Q2, things have improved since then. The picture as we are presenting it for the quarter is correct, but since then we have been able to catch up and get to where we're supposed to be. And the training targets that we have, we do training, as you will see, Q1, 140, Q2, 225, etc. We set these targets in consultation with provinces, because it's the provinces that identify the targets for support in particular programs using our designed training programs, and they also fund these training programs, and we work with them in tailoring training programs that are going to respond to the needs of the. So in consultation with those, you will see what we have here, because sometimes they involve costs that are going to take instructors or scientists to specific locations. Sometimes it's classroom based. It depends. It differs, and so the numbers have to be realistic and have to talk to the resources that have been placed behind that. Honorable Davids asked about the ERP system implementation. We are very pleased that we have completed, it's a huge task, everybody knows. We have completed the process of putting this system to run our operations and our procurement. There were teething problems as expected, particularly in the first quarter of the year. And those were picked up and resolved. And part of them was some reporting on the reporting side where we were getting some duplicate transactions, etc. But all of that has since been cleaned up, and we are very pleased that we were able to complete that project within time and within budget. Thank you very much, Chair.
Thank you, CEO. Let's go to the National Agricultural Marketing Council, Doctor.
Thank you, Chair. The question from Honorable Trolip about the EU trade restrictions and the dispute that South Africa has with the EU, I think Mr. Serach, I've just had a quick chat with him. He will be able to respond more adequately to that from a regulatory point of view. Honorable Aris.
Continue, Doctor.
Oh. Honorable Aris asked a question around the newly appointed council. I would like to confirm that indeed we have a new council that has been appointed with effect from the 10th of March. And the newly appointed chair is here today. And I think we could provide the full media statement that lists all the members. If the
Don't go there.
Okay. All right.
It's not your responsibility to do that. I said it from the beginning when we started this meeting.
Thank you, Chair. There was a question from Honorable Aris about the progress made. What is the progress made with regards to looking at our mandate, which is currently advisory, versus offering or enabling us to do some more direct work? Chair, I don't have an answer to that as well, because it's not necessarily our responsibility as the NAMC, but I know there is a process that is looking at the review of the Act currently. The issue of the transformation levy, once-off transformation levy, just to give an update that according to our new guidelines, there's a requirement that 20%, at least 20% of the levy is spent towards transformation. There were debates about how adequate that amount is, but I think we've gone a long way in making sure that the guidelines are revised to take into account that the amount is quite small ultimately. So I think that at least is very key there, because industries, 20% is just the basis, and industries often are able to exceed that 20% amount. But more than that, Chair, it's important to note that what the Agriculture and Agro-Processing Master Plan has introduced is the approach of public-private partnerships to realize that, for example, the 20% from the levies could be augmented by current government programs such as CASP and others, in order to augment that amount to increase the potential impact on transformation. Honorable Ndalane asked about the collaboration that we have in support of farmers. One of the examples that I could quote, Chair, is the current MOU that we have with the PPECB, where we are synchronizing information, we're sharing information about the farmers that PPECB, for example, supports from a certification point of view, and those farmers then get moved to us or get shared with us. That information gets shared with us to take further in terms of market access support. So there is an MOU that we have entered into, which we have piloted over the past year And this looks to make quite a difference in how we coordinate our work going forward. Honorable Mtetwa suggested that perhaps we should look at issues of land when it comes to our advisory. I think what I would like to say about that, Chair, is that we want to try and limit ourselves to agricultural marketing policy related advisory. Yes. And we're happy to contribute in any way to other types of analysis, but we want to focus more on agricultural marketing policy, and this is what we've been focusing on currently. There was an issue around market access demographics as well from Honorable Mtetwa, and I would like to answer this in conjunction with a question from Honorable Mutama. I think we recognize and realize the enormity of the challenge around market access, and the planning that we do in contributing towards addressing this challenge as the NAMC is based on the resources that we have, but we realize that we are not alone in this space. So what we tend to do is to look out for collaboration opportunities in this regard. As I said earlier, Chair, the Agriculture and Agro-Processing Master Plan does provide that platform for better coordination of this. And I'm happy to report that there is some progress that is currently being made through public-private partnerships in this regard, where in 2019, the value of produce that comes from black participants going into the market stood at about 11% of the total commercial value across all the agricultural value chains. But that figure has gone up now to about 13% in terms of the recent figures that we have. And I think if this collaboration and coordinated approach under the AMP is sustained, this figure is likely to go even higher. Honorable Davids asked about the impact of the war. We have not done any specific analysis on this yet, but it is in the pipeline. But I think what we have observed currently is that the immediate impact obviously will be on the oil price, which will have inflationary effect, which will play out in the increase, for example, in the price of inputs, which will ultimately affect food prices. But I think details will come through when we get into the specifics of the study itself. And at this stage, we are not yet there yet, but we are happy to provide that information when it is available. Thank you, Chair.
Thank you very much, Dr. Ngawini. We're going to you, CEO at PPECB.
Thank you, Chairperson. Just in terms of the question on the citrus to the EU, I'm sure we've determined that Mr. Sarahi will answer this, as is a phytosanitary matter, and that rests with the department. On the question of the situation within the Cape Town terminal, yes, the terminal was obviously during December and way into January and February, had issues with severe winds. The PPECB formed part of the coordination team in order to provide information to Transnet as to what was booked for loading, so that planning can be better and then they can be better prepared. On the matter of the shortage of personnel in peak season, we had one query from Houtgro specifically, and we also read about this in the media. I had made contact immediately with the CEO of Houtgro, which couldn't provide me with who was the complainant in order for us to investigate this. We went a step further, and I wrote to all the clients within the PAL region, as it said that this originated from PAL, to request them to please report who it was, which packhouse, and who the PPECB staff member was that didn't pitch for work. Unfortunately, till this date, we could not get any feedback on that. Chair, the committee should be reminded that PPECB's #1 objective is client satisfaction, and we will do everything in our power to make sure that we can deliver a service to clients. In terms of the Agricultural Export Technologies Program, currently we train just over 50 students, and I can confidently say that most of these students are employed after their 1-year training, are employed with the PPECB. If not, we also make the names available to the industry for them to appoint the students, the fully trained students. And this program has served the PPECB well and the industry over the past couple of years. We are obviously looking at ways to increase the program, and we do that on a year-to-year basis. If I can recall, in 2008, the program started with just over 20 students. I think we're sitting at 50 students a year that we do train. On the question of the origins of products, I think the CEO of NMC has to a certain extent answered this, but from our side, we do, when produce are presented for exports, we do ask farmers for the what we call the product unit code, and this with the Department of Agriculture, I believe we can trace in terms of which regions these produce are from. So if you would allow me some time, I will certainly engage with the department to see what is possible in that regard. In terms of the percentage and scale of farmers to train, this program we do in collaboration with the Department of Agriculture and with all 9 provinces. So the farmers that gets presented to the PPECB to train in terms of this program is presented to us by the respective provinces. So we are fairly reliant on the provinces to do this for both the department and the PPECB. In terms of the spend on BEE, and thank you for the member for noting that. We certainly, this is one of our major objectives, 86% up to September, and that is the end of Q2, that amounts to 82 million rand that we spent in terms of procurement on BEE registered supplies until the end of Q2. With regards to seasonal workers and their prospects, every year we determine the baseline of our permanent staff complement and the needs, and this is based on the export volumes. So we do a calculation, and every year we increase our permanent staff complement. We increase with the number that obviously is the minimum for exports, because we are then confident that these are or those will be the minimum requirements for the PPECB to deliver its services to clients. So every year we do increase the staff complement, and most of the temporary employees in that year then gets appointed with the available positions that we do have. There is also skills transfer to both, which will give the temporary staff members a, let's say, a better opportunity to be employed if they do not get employed by the PPECB. And we found that many of these seasonal workers are employed by industry, which is also to a benefit of the PPECB, as they know exactly what we require. Chair, I think there's just one question left, and that is the percentage of exports from small-scale farmers. Currently, it's not a requirement for the PPECB to ask for what is the type of farmers that gets exported. I will, however, engage with my colleague from the NAMC to see whether there is a report and some reports that we can provide to the committee. Chair, I think I've touched on all the questions. Thank you.
Thank you very much. DDG?
Thank you, honourable members, honourable chair. It's a question by honourable Trollip. The non-tariff barrier is still in existence, and as we members remember, the CBS one is over 20 years. FCM is nearing 10 years. We haven't moved. As at November 2025, the process was at the dispute resolution process, where independent technical advisors were to be appointed to hear our case. It takes a very slow pace, and we haven't moved any further than that. And we still anticipate that it's going to take some time before the panel can sit and adjudicate on the situation, on the matters. But maybe important to note is that ever since we've been exporting citrus to the EU, CBS has not established in the EU, as well as false cotton moth has not established in the EU, despite the interceptions that they have. So this proves our case that the fruits are not necessarily pathways, but the process is still at the dispute resolution stage. Thank you.
Thank you very much, DDG. Just distracting me. Thank you very much to the responses, CEOs and the briefing that you gave us, including the CFOs. We do appreciate it. We just don't have more time anymore. Otherwise, I know that members would have wanted to come back and take a second bite. I just want to address the issue of the National Agricultural Marketing Council Board, Minister, that we shouldn't be informed by the NAMC. The responsibility is with the minister. You know, on Section 4 of the amended Marketing of Agricultural Products Act number 47, 1996. It stipulates that whenever it is necessary to appoint a member of the council, the minister shall, by notice in Gazette, as well as other appropriate media, and by invitation to the parliamentary committees, call for nominations of persons who comply with the criteria referred to in subsection 2. And I think that, Minister, we did speak about this matter last year. And subsequent to that, I personally spoke to DDG Komape, who had a different view from this, what I've just quoted, that we had no business as a committee to be involved here, but I'm just reiterating here from the Act. And irrespective of what the officials advise you, Minister, our responsibility as a committee is to talk to you, and it's your responsibility to understand the Act and do as the Act says. So we were not informed. Of course, we sit here, it's water under the bridge, but we need to raise it, Minister. For an example, I was advised through that statement that the CEO of NMC is raising or is referring to, that the board was appointed somewhere around the 10th, if I'm not mistaken, of March, of which you have, Minister, as the Minister, about 30 days in relation to the Act to inform the committee. So it's not yet 30 days from the 10th. However, given the fact that there is going to be recess from Parliament, I want to believe that, Minister, it could have helped that you inform us, especially that it's very awkward for us to meet the chairperson here without having been introduced to him. So it becomes very difficult how we introduce him, and we definitely had to ask him to introduce himself because we didn't have, information. I'm just raising it, Minister, that just remember it. Last year when we spoke, we even spoke about the ARC, and I'm not going to talk about the other entities, but the ARC, I know that the board time is lapsing. Somewhere this year, I don't know whether it's May, June, or July, but somewhere I remember that we spoke with the chairperson, Minister, and yourself last year in committee room 1. I think it's Plain Street. What is that? 120 Plain Street. I remember where we were sitting. So, and I realized that it means that the other process of the ARC have not started. And I want to believe that you will inform us on time, Minister, when the process starts, because the same applies with the ARC, that the committees need to be informed, so that when the nominations are done, we also know, and if there are people who members know, they can encourage that they apply. So, yeah. I wanted to raise that, Minister, before we close, and I want to give you an opportunity to make comments.
Noted, Chair, and we will meet the obligation in terms of the legislation.
Okay. Thank you very much, colleagues. My appreciation for your time today. Thank you very much. We were supposed to meet somewhere around honourable members the 31st. Given the fact that the program of Parliament has changed, it means we will go back to the program and look at the items of the meetings that were supposed to happen next week and schedule it likewise. To the Minister, thank you very much for availing yourself, to your officials led by the DG, the entities led by the chairpersons. Thank you very much. We will meet you next time and have a lovely afternoon.